Folks, good people, welcome, welcome, welcome. I know I am late this morning. It just seems like I spent the entire summer getting up on time, and now that the summer is winding down, here I am. Here I am, not getting up on time, not getting up on time. What we're doing is we're looking to complete. What we on day 4 of the Ali trial. We're gonna watch the testimony when they came back from lunch. Let me see. All right. Let me get us there. I'm so behind, y'all. I apologize for being late and then not even having everything queued up. All right, let's get this share button. And let me share the screen. Yeah. All right, here we go.
When you're ready.
Thank you. Good afternoon, Dr. Stankus.
Good afternoon.
Would you please state your full name, spell your last name for the record, please?
Sure, Jennifer Stankus, Stankus.
And Dr. Stankus, could you tell us what your education history is?
Sure, I'm an emergency physician. I went to medical school at the University of Washington. Before that, I went to law school at the University of Denver. And before that, I went to undergraduate at the University of Colorado at Boulder.
And what kind of work do you do?
I'm an emergency physician. I practice at Madigan Army Medical Center as clinical faculty in the emergency department.
Okay, and what else do you do for work?
So at this point, over the last few years, I've been about half-time clinical medically, and then the other half of my time is split between doing some expert work like this and other work that's not related to medicine.
Okay, and are you a member of any professional associations?
I am. I'm a fellow of the American College of Emergency Physicians and a former chairperson of the Emergency Medicine Foundation and a diplomat of the American Board of Emergency Medicine.
Okay, and Dr. Stankus, have you ever qualified to be a expert witness before?
Yes.
Okay, and what field do you expert witness in?
So I'm asked to opine on medical questions, and that can be in civil cases or like this in criminal cases. So it's been a pretty broad range of cases.
Okay. And you indicated you were an expert witness, so are you paid to be here?
I am.
Okay. And does the fact that you're being paid have any influence on your testimony?
No.
And is the amount you're being paid a customary amount?
Yes.
Okay. So we are here on the case of State versus Ali and Ali. Have you had an opportunity to review the medical records in this case?
I have.
And have you reviewed anything else?
Yes.
What else did you review?
I reviewed the police reports and also the videos.
Okay. And you saw the bus video and also the handheld phone videos?
I did.
Okay. And when you reviewed those records and that video, did the diagnosis and things that you found in the medical reports, did that seem consistent with what you viewed and read?
It did.
Okay. And one of the things that was an issue, that's going to be an issue in this case, is something called pneumomediastinum. Could you please tell us what that is?
Sure. Pneumo just means air. Mediastinum is the central cavity in the chest. It's the area, basically, media is middle, and stinum, you can think of your sternum, so it's the cavity there. Pneumomediastinum means that there's air in that cavity, and there shouldn't be air in that cavity. There should be air in your trachea and in your lungs and in your esophagus sometimes. But it means that there's air inside that cavity, which is unusual.
Okay. And so can you tell us how typically does that air get there?
So it's not a highly common condition, but it does happen.
Okay. And are there, what are some of the different ways it can happen?
So the worst way it can happen is if you are shot or stabbed or some sort of penetration into the chest cavity that actually punctures, punctures your lung, punctures the chest wall, punctures your trachea or your esophagus. That would be a very bad day. Other causes, believe it or not, it can happen with a sneezing fit or vomiting or weightlifting or bearing down. And the reason is that think of your lungs as like a big balloon. You take in the air, it goes into your lungs, and it travels out to the small little air sacs at the end called alveoli. And if you put too much pressure into that, like anything, you can basically pop it. So you can have a situation where you bear down or you're holding your breath and like say someone jumps on top of you or a dog or something like that can actually pop that alveoli. Another way that can happen is if any of you are scuba divers, you hold your breath, something bad happens, you freak out, you pop to the surface and you forget to exhale. Well, all those gases are going to expand and create more pressure. So it's a pressure issue. And then the other way is you can sometimes tear the esophagus, for example. And the way that can happen is with violent vomiting or some sort of penetrating trauma. We call that Boerhaave syndrome.
Okay. All right. So was that B-O-R, Boerhaave?
You're asking me to spell something that's not fair. I think it's B-O-E-R. I'd have to Google it.
Okay. And when the air in your lungs is trapped and the pressure is applied to it, what is that? What is that called? Is that the Macklin effect?
Yes, it commonly occurs, most commonly I would say, and that would be that effect where you're bearing down like a Valsalva. You're increasing the intracranial or the interthoracic pressure too much.
Okay. Now, in terms of generalities, is pneumomediastinum, is that something that's common in strangulation cases?
No.
And have you ever seen it in a strangulation case?
I've seen it. So I've reviewed many strangulation cases, and I have seen it in one case where I don't think that it occurred from that, but rather from being dragged from behind and struggling on the ground.
Okay. And obviously it could be common in a stabbing offense or something like that, right?
Fortunately, I wouldn't say it's common, but it does occur.
Okay. Now, the different ways that it can happen, are some of them considered more serious in terms of diagnosis than others? I mean, in terms of what you're going to do to treat them?
What I would say is that it's not so much the mechanism, but rather the effect. So there can be a very small air leak that is a one-time air leak that doesn't persist, and it goes away on its own. And that could happen from any number of things. Let's say you have a very small puncture, it heals over, and you just have a one-time air leak versus the Macklin effect where you're sneezing or coughing and you have a small little air leak. What matters is if you have a persistent or a large air leak that can create pressure inside the chest. It can actually cause a pneumothorax, if you've ever heard of that, where there's too much air in the chest and starts to collapse a lung. You can have the air in the mediastinum that's actually putting pressure on the heart. The heart's just a big pump, so if you are creating a lot of outside pressure on it, it won't pump as well. It won't be able to do its job. And then the other way that things can go sideways is if you have a tear, especially in your esophagus, what that can do is allow the stomach contents into the or the mediastinum, not pneumo, but the mediastinum, and those contents can create a bad infection. You can become septic, and that can kill you as well. So it's not so much a matter of what the mechanism is, but what the effect is.
Okay. And how do you recognize a pneumomediastinum?
So most typically we'll see it on a chest x-ray. So in a lot of cases, someone will come in with chest pain, or they'll come in as a trauma, and we get an immediate look to make sure that there's nothing dangerous going on. And we can see air very well on x-rays where it's not where it's supposed to be.
Okay. And so once you see that, is it pretty easy to diagnose what it is?
Yes.
Okay. And can you tell me, how do you typically treat it?
So it depends on what it is. So sometimes it's very serious. Say a gunshot wound, they'll have to go in and resect part of the lung or clamp it to stop that air leak, or put in a chest tube. Sometimes a surgeon will have to go in and repair the esophagus. A lot of times we just watch the patient. So about 80 to 90% of the time, the condition is not anything that we need to do anything about, and we'd consider it to be benign, meaning harmless. It's there, but we need to watch it and make sure it doesn't persist or get worse.
Okay. And is there any particular time limit on how long that may take?
Well, typically, if we saw a small amount of air on a chest x-ray, for example, but the patient's vital signs were stable, they weren't having any trouble breathing, everything else looked okay, we would typically watch them for 24 hours and retest and make sure that the condition isn't getting worse and that it's getting better. Okay.
And in your reading of the records in this case, did you note when the condition was first noted?
Yes, it would have been on arrival to the emergency department.
Okay. And did you then also note in the same records when it was determined that it was no longer an issue?
Yes.
And when was that?
The following day.
Okay. So do you recall, was it less than 24 hours later that the condition was no longer noted?
I believe it was.
Okay. Now, upon reviewing the medical records in this case and the videos in this case, is it possible for you to tell with any degree of certainty how the condition arose in this case?
No.
And why not?
Again, there are multiple ways that it can happen. Certainly it could be from any type of struggle where someone is in a fight or a struggle, like for example, in the first instance where there's a tug of war over Fatima and she goes down to the ground. Or the next instance might be where there's, I call it a dog pile, but there's a group of people who all fall on top of her. It could have happened there. There's an instance where they're on the ground and there's contact with her neck. It could have happened there. There's a struggle afterwards that I can't see in any of the videos. It could have happened there. I don't know.
Okay. And so once the person comes into the hospital and they are found to have this condition, is there typical conditions placed upon them when they're being observed?
Yeah, so what we're concerned about, obviously, is that this condition's going to get worse. The patient may need to go to surgery. They may need to be heavily sedated so that a camera can be placed down their trachea or the esophagus, whichever one they're worried about. And in those cases, we don't want the patient to eat or drink anything because they are put at a great risk for aspiration during that procedure. So just like If I'm worried about someone with appendicitis, they come in with right lower abdominal pain, I'm going to have them not eat or drink anything until we know that it's not that and that they're not going to surgery. So we'll keep the person what we call NPO, or nothing by mouth, until we have a better idea of what the clinical picture is and if they need any further intervention.
Okay.
And then obviously we watch them. They're on a monitor. We're making sure that they're not going into any respiratory distress or cardiac distress or anything like that.
All right. And in this particular case, when you reviewed the medical records, did you see any sort of a specific treatment that was undertaken in this case?
I believe, obviously, observation, imaging in terms of x-rays, and then I believe an antibiotic was given and the patient was kept NPO, as we call it, or nothing by mouth.
Okay. And did you see any indication that there were any scopes done or anything else?
No.
And is that typical in a case like this?
I would say it is. With a very small amount of air that resolves, there's no reason to put that patient at risk because there's not an obvious ongoing air leak.
Okay. Is there typically any difference in a case of pneumomediastinum where a younger person is involved versus a full-grown adult?
The only thing that I would say is that younger patients, especially very young patients, have smaller airways, and so if there is some sort of compressive element, like an ongoing air leak, they can decompensate faster than adults, but the mechanism overall is the same. So they're treated the same way.
Okay. And can you tell me what tension mediastinum?
Yeah, so tension mediastinum, again, is pressure or tension on the contents of the mediastinum. And in that case, we're talking about compressive pressure on the heart. So if you can imagine your heart wants to beat in its usual fashion, if you're putting tension on it, just like if you're putting fluid around the sac in the heart's not able to beat as well as it would. And in fact, you can end up going into shock from that.
Okay. And if you have this tension mediastinum, then you have more of a continual flow of air in, causing the pressure to build up? Is that what you're saying? Okay.
Correct.
All right. And you had mentioned tears of the esophagus. Obviously, that's something that sounds pretty serious. What does that cause?
Again, so that can cause stomach contents to leak into the mediastinum. And again, that's really dangerous because of the risk of infection.
And again, no evidence of that in this case that you
No.
saw? Okay. What is a mucosal tear?
So the mucosa is like the lining of your mouth. Or the lining of your trachea. It's just a tear in that, in that material.
Okay. And was there one noted in this case?
It was suspected but not confirmed.
Okay. And what does that mean to you?
So you can't tell if someone has a mucosal tear in their esophagus or in their trachea by CT scan. You just can't see that level of detail. You need to go in with a scope and actually visually inspect it to see if there's a tear there, and that wasn't done in this case.
Okay. And is that generally, do you think, because this case resolved on its own?
Yes.
Okay. And what about mediastinitis? What is that?
So that would be inflammation around the mediastinum, as you would see with an esophageal tear, for example.
Okay. And you said one of the big issues that could be dangerous in certain cases of pneumomediastitis is infections?
It can be.
Okay. And were there any infections noted in the medical records in this case?
No.
Okay. So you said 80 to 90% of these cases typically resolve on their own. Does that just mean, what does that mean in terms of resolve on their own?
It means that we see some air where it's not supposed to be, and that it doesn't progress into a more dangerous condition, and that no intervention is needed, and so that's it. The patient gets better, and we don't need to do anything.
Okay. And so in your case, how would you classify the condition pneumomediastinum as it applies to Fatima?
I would say it was a mild presentation of it that resolved completely by the next day.
Okay. And given what you know, was this condition going to ever cause her death or kill her?
No.
Okay. And when something like this happens and it resolves, does it leave any permanent damage?
No.
And does it cause any permanent injury in any way?
No.
All right. I think that those are the questions that I have for you. Thank you.
Thank you.
Mr. Larry, cross-examination?
Just a couple questions, Your Honor. Really just about to. Good afternoon. Thank
Good
you.
afternoon.
You talked about the risk of aspiration in surgery, and that is when food doesn't stay in the stomach or saliva and goes into the lungs. Is that
Yes.
accurate?
Yes.
And so what's the consequence of food or saliva or something going into someone's lungs?
So it can cause respiratory failure at the worst. It can cause infection and scarring of the lung.
Okay. Pneumonia?
Yes.
Okay. And so when you said nothing by mouth, if somebody has to go into surgery and they have eaten within 24 hours, it increases the risk of aspiration. Is that correct?
Yes.
And so the reason to not have somebody eat during this 24-hour period is if something goes wrong and they have to go into surgery, you don't want to increase the risk of aspiration. Is that fair?
Yes.
Okay. So if this had happened on a backpacking trip and this person was a 3-4 day hike out, okay, in this scenario, no helicopter rescue, and she didn't get medical treatment, would the outcome have been different?
In this case, no.
How come?
So there was obviously a small air leak, and we know that because of the chest x-ray. If this had happened out in the backcountry, there wouldn't have been an x-ray, and probably no one would have known that it was even there. There was no demise of the patient in terms of a change in vital signs or difficulty breathing or anything along those lines. If they hadn't taken the x-ray, they would never have even known that it was there.
And so if I was backpacking and this had happened, and I'm talking to this person, would this person have known something's going on with my chest? I feel like I have air in my chest. What does the patient understand in general?
So oftentimes they'll have some pain. They may have some chest pain or some neck pain where the air is dissected or something like that. But someone who has a persistent air leak where the air keeps filling up and compressing the lungs, they become increasingly more uncomfortable, may have increasing shortness of breath or chest pain or racing heart as the heart's trying to compensate because it can't beat well, any number of things.
And in this situation, were any of those symptoms about persistent air leak, pressure on the heart, collapsing lung present that from what you saw?
No.
So this is a situation where she comes into the emergency department, there's a whole array of tests done. Fair? Or,
There's an array of tests done.
okay. including an x-ray, correct?
Yes,
A chest x-ray.
yes,
And what you're saying is that the chest x-ray would have been what picked up this air?
that would be the first way to pick up the air, and then a lot of times we'll do a CAT scan
Okay.
after that, and then watch the patient.
Okay. So really, this was testing that identified the issue and then was simply monitored for 24 hours.
Correct,
And there was no intervention needed.
correct.
Okay. I appreciate your time. Thank you.
Thank you. Ms. Stone, cross-examination.
Thank you.
Good afternoon, Dr. Stinkis.
Good afternoon.
It's good to see you.
Nice to see you too.
Dr. Stinkis, I have some questions.
I thought you might.
Yep. Dr. Stinkis, you talked about preparing for this case by looking at medical records. Do you recall that?
Yes,
Okay. And you also indicated that you looked at, I think, video. Did you say photographs as well?
I did, yes.
And for those photographs, were those, what photographs were those?
Oh boy, they were contained within the medical record.
Okay. And so were those photos of Fatima?
Yes,
Okay. And do you recall what those were photographs of?
primarily of her head and neck, but also just a full body video, or not video, rather a photograph.
Okay. And do you recall when you were looking at those photographs, did those photographs of her injury play is not the right word, but factor into your opinion or diagnosis or evaluation in any way?
I mean, I certainly considered them, yes.
Okay. And how did you consider them? What does that mean when you say that, ma'am?
So there was obvious contact with the neck, the head and neck. There were some abrasions on her shoulders and her neck with some bruising.
Okay. And when you were going through and trying to prepare kind of your opinion for today, did you look at any research articles or anything of that nature about either strangulation or pneumomediastinum, anything like that?
No,
Okay. And you've never met or treated Fatima before, is that correct?
I have not.
Okay. And Mr. Kading asked you about just payment for testimony being here in that customary rate. What does a customary rate mean?
So expert witnesses in this state typically earn about $500 an hour.
Okay. What about if you're coming for testimony itself?
So I typically charge my clinical fee for the day, which is $2,400.
Okay. And what about if you're writing a report? Is that extra for a report, or is that included as part of that process in time, in terms of time that you would spend?
It's included, so it's just an hourly rate.
Okay. You didn't create a report here though, correct?
I did not.
Okay. Were you asked to create a report here?
I was not.
And you talked about, I don't recall if you talked about testifying before or working just in other fields as part of your other part of your time. Do you remember that?
I do.
Okay. Have you actually testified before
I have.
in a criminal case?
I have.
Okay. On behalf of the prosecution?
Not in trial, no.
Okay. And you talked about, in terms of your experience and where you've worked, it's primarily in the ER, in the emergency medical field. Is that correct?
Yes.
Okay, so not in like pediatric medicine, anything specialty in strangulation, ENT, nothing like that?
No, we treat adults and kids, and it's a big part of our training. Maybe 30% of our patient population is pediatric.
Sure, absolutely. And so you would assume that folks that worked in the ER were trained in a broad field of folks, right? I mean, the medical degree is the medical degree.
No, I mean, emergency medicine is its own specialty, and so in order to work in the emergency department, you have to be credentialed to do that and have specialized training.
Sure. And so you would say the same would be true for like an ENT or a pediatric doctor, fair? Yes?
Fair. As we discussed, a pediatric doctor or pediatrician couldn't work in the emergency department as an emergency physician, even a pediatric emergency department, unless they were specialty trained in emergency medicine. Any emergency physician trained in emergency medicine could work in a pediatric emergency department.
And if you were in the ER and you needed something exceptional was happening, would you call a specialist in that field?
Yes.
Come assist?
Yes.
Okay. Are you aware that there are, in fact, strangulation specialists and ENTs that will confer with specialists in that field?
It's not a specialty field. Different people, different specialists would tend to see it. We obviously see it because the patient comes to us first. If there is a significant injury to the neck, an ENT doctor or ear, nose, and throat doctor might take care of that.
Okay. And ER, or emergency medicine, would you agree that that is kind of a triage medicine by definition?
No.
No? Okay.
No.
So you're admitting and then you're caring and you're maintaining care for those patients once you're done seeing them in the ER?
So we diagnose and stabilize and do the initial treatment. Sometimes, for example, we'll do a scope in the emergency department. We do a lot of procedures and interventions. If the patient needs further specialty care, so as an example, we would be the one to diagnose a heart attack. And then we would call the cardiologist to take that patient to the cath lab to do any interventions that were needed, because we obviously don't do that.
Okay, so then that follow-on care would be farmed is not the right word, but farmed out to someone else for that longer term care after the initial diagnosis and stabilization. Do I understand?
Yeah, so once we diagnose, do any procedures we need to do, life-saving procedures, stabilize the patient, then that patient may go onto the floor of the hospital or the ICU or straight to surgery or something along those lines.
Okay, and in this case, was the request to you then, or really the entirety of the request, just to evaluate the pneumomediastinum as it existed here?
Yes.
Okay. And was there any request to opine about strangulation at all, or look into that piece of the medical records and come to an opinion about that?
There was none.
Okay. And I think you talked about those three kind of manners in which pneumomediastinum could occur. You talked about the penetrating injury. Is that correct?
Yes.
And Macklin's effect, and the agreed that no one knows how to spell Borhaus effect as we stand here.
Borhaus syndrome. Yeah.
Thank you. Borhaus syndrome. And if I understand your opinion of the Macklin effect, and I don't say opinion, your testimony about the Macklin effect, you're saying that that is only happens as a result of chest compression. So it's only happening when somebody, there's an external compression on the chest and the airflow has been cut off. Is that your opinion, or are we misunderstanding that?
Well, that is one way that it can happen.
Okay.
So, as we discussed before, if someone takes a deep breath, for example, it's not unlike the scuba diving in a way. If you take a deep breath or you're startled and go down and someone lands on top of you and you have a sudden compressive effect, it's like taking a balloon and squeezing it very tightly. There's a possibility it could pop. If, on the other hand, your mouth is open and you just jump on top of the person, there's not that increased pressure, you're not going to have that effect. So we talked about that compression, but then we also talked about any type of Valsalva maneuver where you're bearing down and you're activating your abdominal muscles and you're bearing down in your chest. What that does is it increases the intrathoracic pressure. And if you do that hard enough, like with violent vomiting or struggling, or sometimes you can see it in wrestling or weightlifting, something along those lines, you can have that same effect.
And so you used wrestling as an example. So when we talk about it in terms of wrestling and bearing down and breathing hard, why did you use wrestling as an example?
Just because I've seen that happen. For example, another thing that you can see sometimes is like petechiae. That's another example of how you can have increased basically backflow that causes little ruptures. In that case, it's with the vascular system, not the airway, but it's the same concept. You know, I've seen it with people who've been arm wrestling, for example.
So when you're talking about, let's say, like petechiae or the pneumomediastinum, let's say that somebody is strangling you from behind, they have you in a arm bar and you're gasping for air. Would you anticipate that that could cause a pneumomediastinum and or petechiae?
It could, yes.
Okay. Would that be consistent with the Macklin effect then that you're talking about?
It could, yes.
Okay. You talked about identifying if there is a tear in the trachea or esophagus by potentially doing a scope. Do you recall
Yes.
that? Okay. That's pretty common means for checking to see if there's a tear. Is that fair?
Yeah, and I would say that if you're talking about mucosal tear, that's the only way to see it. You won't see that level of detail on a CAT scan.
Okay. And would you agree that if there has been trauma to someone's throat, you may be disinclined from a medical perspective to put a scope down there and add trauma to see if there's already trauma? Does that question make sense?
It does make sense, but you're not causing more trauma by putting a scope down. You're basically, so when you're talking about the trachea remains open, unlike the esophagus, with the cartilaginous rings around it. It's always open. It doesn't collapse like the esophagus can. You're just putting a small, I almost want to say like this, the caliber of this, and there's a little light and a camera on the end of it, and you're literally just going down and you're looking around to make sure that you don't see any injury, like no bubbles of air or blood or other things that would indicate an air leak. So I wouldn't say that it would cause more trauma.
Just wanted to indicate the doctor held up one of the cables, very thinner cables from the microphone system as she was trying to describe the size of the scope.
I apologize.
Well, you're fine.
And I would say it's about a 1/4 inch diameter.
Thank you. And earlier you said one of the concerns that you have when dealing with children is that I'm going to use the wrong term, so please correct me, that the throat size is smaller, right? The airway is smaller. Is that fair?
Everything's smaller. Yeah.
Right. Yeah. By definition, everything on a child is smaller. Does that give you then more concern or more, are you more cautious then as a doctor in terms of injuries that may have occurred to a child and how you're going to treat that child?
Yeah, so like I said, if for example, there's a persistent air leak in a child, that may cause decompensation more rapidly, especially around the airway, because it's a smaller airway to have to compress.
So in this case, would you, knowing that a pneumomediastinum is presented in Fatima, knowing that the injuries that she has incurred and knowing what has been described as the cause of those injuries, and specifically a prolonged strangulation, are you saying you would have scoped Fatima to see what was happening in her throat, or do you agree that the scope was not appropriate?
Well, the reason it wasn't appropriate was because it was such a small amount of air, and because there was no respiratory distress, her vital signs were normal. If you were truly concerned about a persistent air leak due to trauma, or you were concerned that there was a lot of swelling around the airway and that the airway would be closed, you'd actually probably prophylactically intubate her. So if you were worried that there was that much trauma to the airway, you might even intubate.
You might, but not necessarily.
If you are worried about airway and significant amount of soft tissue swelling, especially over that next day, but not without any respiratory distress, not without any difficulty breathing or swallowing or voice changes or evidence of, for example, fractures in the cartilage of the neck, I don't think it was indicated in this case.
But that would be assuming you know what the source of the leak is, though, also, correct?
Not necessarily.
Okay, so tell me about that.
You could have potentially a small mucosal tear that is creates a one-time brief passage of air into the mediastinum and seals itself over, and you don't have a persistent leak. You could also have one of the alveoli rupture, like we talked about in the Macklin effect, and you have a transient passage of air, it seals itself up, and that's it. There's no additional leakage.
But you don't know what that source is without looking. Is that fair?
You can't know.
Okay. And the standard of care, if you're worried about someone with a pneumomediastinum, is that you call an ENT and or keep them for observation. That's correct? I understood that
Yes.
from your testimony? Okay.
Yes.
And is that because that condition can go poorly? It could go great, but it could also go very poorly. Fair?
Absolutely.
Okay. And I think, as you said earlier, you're not involved in that aftercare. You know what the care is supposed to be, but you're not actually involved in that. Fair?
Fair.
Okay. And you're not just sending a patient with pneumomediastinum home and saying, call us if something goes south, right?
I wouldn't do that.
Okay. Would that be the same with strangulation patients then? If somebody came in and said, complained of strangulation, described this incident that occurred to you, and you saw a pneumomediastinum, you also wouldn't be sending that patient home? And saying,
Correct.
just call us.
Correct. So the things that would keep that patient in the hospital would be significant airway restriction of the airway, or significant swelling around the structures of the airway causing constriction on the airway, any type of vascular injury, any fractures in the neck, or pneumomediastinum.
Okay. And so you said you agreed that pneumomediastinum can occur after strangulation, and particularly that manual strangulation creates that increased air pressure in the chest cavity during the incident itself. You would agree with that?
It can.
Okay. And when that air then leaves the chest cavity and air moves, right? Generally speaking, it's not stagnant?
Yes, it moves.
Okay. And if it then dissects the neck and the chest, can that cause a subcutaneous emphysema?
Yes, in fact, sometimes that's all we see. So one of the things that we do in trauma patients is we always just feel the skin, and we call it crepitus. And so sometimes you can definitely feel that the air in all of the tissues.
Can you explain to the jury what subcutaneous emphysema is?
It's just air within the skin tissues and the fat. And so it's almost like we call it like Rice Krispies. So if it's there, a lot of times you can feel it. It feels very odd. It's not supposed to be there.
It's another place the air is not supposed to be, is under the skin?
Yes.
Okay. And I think I understood your testimony with Mr. Kading, but you indicated that some of the complications that can arise from pneumomediastinum is the mediastinitis,
Yes.
okay, and tension pneumomediastinum.
Yes.
Did you talk about pneumopericardium?
No, but we kind of discussed that same mechanism.
You kind of talked about the pneumothorax, is that right?
Pneumothorax, but also compressive elements on the heart.
So if you're talking about pneumopericardium, can you tell the jury what that is?
So it could be air within the pericardial sac. So you have the heart, and then you have the sac that surrounds the heart. And sometimes you can have blood that's going into there, bleeding into that sac. You could, with penetrating trauma, have air. Or you could just have air within the mediastinum itself that is building up and just having a compressive force on all of it, on the pericardium and the cardiac tissue itself.
And each of those complications that arise from the pneumomediastinum could all potentially be life-threatening if things don't go well. Is that fair to say?
Yeah, if you have continued pressure on all of those structures, that can cause collapse of lungs and cardiovascular collapse or shock.
Okay, thank you. And you talked about something being benign. I think you used the word benign with Mr. Kading, that in this case, the pneumomediastinum ended up being benign. You don't know that something is going to be benign at the outset, right? Meaning, maybe I phrase this a different way. You could have a concussion, you could have a brain bleed, you could have swelling of the brain. All of those things could end up, or a tumor, all of those things could be benign, but that it could also not. Is that correct?
I think the examples are not any examples I would use. Like,
Okay.
You could have abdominal pain that ends up being nothing requiring surgery or any intervention. Could you have a really small brain bleed that doesn't require anything, doesn't cause any swelling? I wouldn't use the example of brain swelling. That would be
Okay.
that would be more serious under
You
any
wouldn't call that
circumstances.
benign.
No.
Okay. Would you keep, generally speaking, what else would you put in the category of benign?
Some sort of like a mole. It's not going to progress to, it's abnormal, it's a growth on the skin, but it's not going to develop into a cancer probably.
Sure. But would you agree that someone with, say, for example, a mole doesn't come into the ER and then get admitted for observation for a number of days?
No, but I would also say that we keep people for abdominal pain while we're waiting results to make sure that there's nothing serious in that. And we may not do anything about it. There may not be anything serious with that, but we still need to look.
Sure. And if Fatima had just come in with just pain in her chest and just a pneumomediastinum with nothing else occurring, is it your opinion that maybe the treatment would have been different than it is in the current case?
No, I think she would have been admitted and observed to make sure that that wasn't something more serious.
And when the pneumomediastinum resolved, so to speak, within 24 hours, she wasn't released either. Is that correct?
I don't believe so, no.
Okay. And if I understand, you said it's not uncommon, but it's not common either. Pneumomediastinum as a one of the effects of strangulation. That's not common, but also not uncommon. Is that correct?
With respect to strangulation, I've reviewed hundreds of cases, and again, I've only seen one other case.
And yeah, I think you described that case as a dragging case. Is that right?
So the person was dragged by a hoodie and then got into a wrestling match over a phone or something.
Okay, so there was pressure around that person's neck, and then they were drugged by that pressure, and then wrestling of some sort occurred as well. Is that fair?
Correct.
Okay. And in the course of your, remind me how long, I believe you said it was 10 years at some point in the ER, is that right?
Yes.
Okay. In the course of your 10 years, how many times have you seen pneumomediastinum?
You know, actually, we talked about this. I don't keep track of these records. I don't know. Maybe a dozen, like, gross pneumomediastinum. I mean, we see that subcutaneous air, so we know that there's an air leak somewhere, but you don't necessarily see pneumomediastinum on imaging. But again, it's not particularly common.
So less than a dozen times in a dozen or less times in the last 10 years?
I don't know. I think that's probably an understatement, but I don't want to overstate either.
Sure, no, I appreciate that. And you don't have a recollection of male, female, young, old, is that fair?
That's fair.
Okay. And would you agree that strangulation itself is very serious?
Yes.
Okay. And would you agree that strangulation in a child is potentially even more concerning than an adult?
I mean, they're both concerning. But what I
Sure.
would say is, as with the pneumomediastinum, in kids, the airway is more narrow, and so it takes less less to close that airway. So if you have an airway that's an inch in diameter versus a half an inch, obviously it takes less to close that half-inch diameter airway.
So then, if I understand right, your testimony is that plainly the amount of force that it would require to significantly damage a child would be less to damage a child than it would be to use on an adult. Is that fair? I mean, in terms of closed.
Adults' neck and that sort of thing is more than most kids anyway.
Well, tell me, what do you mean by that?
Just all the tissues in the neck, and obviously there are people on the jury, for example, who have more muscle and more tissue that would have to be compressed to get to the airway.
So if I understand correctly, that a child's neck is just generally more vulnerable or more susceptible to that. Is that correct?
I'd say that's probably accurate.
And would you agree that a 17-year-old, a small 17-year-old female might fall into that category?
And she is right on the cusp of being an adult, but I don't have an opinion on that.
Let's say if she's 5'1" and she weighs 100 pounds, would somebody of that stature be more concerning in terms of what an adult is able to do to them if they're strangling them?
What I would say is that it's all concerning. It's hard to differentiate any person. A smaller person is going to be more vulnerable than a very large person.
Sure, and obviously not to minimize strangling to anyone, correct? But if you're talking about a child, you have concerns about the impact on a child, that would be different, whether it results in a pneumomediastinum or one of the other complications that you've identified. Does that impact a child and their development differently, potentially?
I mean, at 17, we're talking almost fully grown, but I'm not sure what you mean.
Well, at 17, a child's brain is still developing. You would agree with that. There's still another brain development curve from 22 to 26. So
Sure.
They have developed, but there's still more to come, yes?
Sure.
Okay.
Although I'm not a neurocognitive expert, but sure.
Well, would you agree that there is a brain development still coming from 22 to 26? Give it thereabouts. I mean, and car insurance companies figured it out a lot earlier than the rest of us, fair?
And rental car companies.
Yes. Fair?
Fair.
Okay. Would you agree that if you saw indications in the emergency room of strangulation of a child, you wouldn't simply indicate that it was benign and send that child home, let alone home with their parents? Is that fair?
So typically what our practice is in the emergency department is, again, if there is evidence of strangulation, we almost always do a CAT scan of the head and neck, and we look for any vascular injuries. We look for any fractures in the neck. We look for any significant swelling of the neck. If the patient, if all of those things are normal, it's not it would be our standard to send that patient home with return precautions. If any of those things are abnormal, it would be our standard of care to admit them, at least for an observation period.
And if you have a child coming in complaining of strangulation and you're seeing that pneumomediastinum, and the allegation was that the parent was the perpetrator, would you be sending that child back home with that parent?
I mean, I think the question in a certain sense is moot, because if you see pneumomediastinum on any patient, I would admit that patient for observation.
Okay. And do you agree that strangulation, whether pneumomediastinum is present or not, can result in death?
I'm sorry, ask that one more time.
Sure. Do you agree that strangulation, whether pneumomediastinum is present or not, can result in death?
It can, yes.
Okay. And you don't regularly see pneumomediastinum as a symptom of strangulation. That is the rarity versus the normal.
Yes.
Okay, thank you. I have no further questions at this time.
Mr. Kading, redirect.
Just a couple of points of clarification. Regarding pneumopericardium, was that what it was? I didn't ask you about that. Was there any indication in any of the medical records that you reviewed in this case that that was in any way an issue?
No.
Okay. And you started talking about some other things I didn't ask you about, like the subcutaneous emphysema. Is that what it was?
Yes.
Okay. And that's where the air is in a different place rather than in the mediastinum area?
So, as we discussed, air likes to move. And so if you have an air leak from the alveoli, the small little sacs in the lung, it's going to start tracking and moving because there aren't like fascial planes or something to stop it. It's going to move around the mediastinum, and with gravity, it goes up. It's going to move its way up. It can also move its way out into the tissues and eventually get resorbed into the tissues. And so you can get this air under the tissues. It's actually better that it goes there than stays in the chest and starts compressing things.
Was there any of that in this case that you saw in the records?
Not that I'm aware of.
And just to clarify then, the air that's in the mediastinum area, what happens to it?
It eventually just gets resorbed.
Okay, so you don't have to do anything to make that happen.
No, unless it's causing a compressive effect, and in that case, we may have to dart the chest with a needle and then put in a chest tube or something like that.
And that would be an indicative of a ongoing air leak into that area though, right?
Absolutely.
And that was not in this case?
Correct.
Okay. I don't think I really have any more questions. Thank you so much.
Thank you.
Thank you. Mr. Larry Recross?
Thank you, Your Honor. I just want to follow up on a couple of points. So Ms. Stone asked, you admit the patient, and she kind of gave you two options. One, it could go poorly, or two, it could go great, correct? That's
Correct.
what, I mean, that was the dichotomy that she set up, correct? Do you remember that?
Yeah, I mean, that's what we're looking for. We're looking for, is this getting worse? Is it resolving? Is it staying the same?
Right. And so to admit a patient is precautionary in some instances, correct?
Yes.
And would you agree that in this situation, it was precautionary for monitoring to see what happens next, correct?
Yes.
She wasn't admitted directly into surgery, correct?
Correct.
And that could have been an option if it appeared that, her vitals were showing signs of distress, correct?
Yes.
Or other indications that this was not going well, correct?
Yes.
But at this point, it was simply in a monitoring phase.
Right.
And then within 24 hours, it turned out that further intervention wasn't necessary, correct?
Yes.
Okay. And then I think you answered this question that I'd written down, but so in terms of the presence of air in the chest cavity, best case scenarios is it resolves naturally. It dissipates through the tissue, through the body, correct?
Right.
The other alternative I think you just talked about is you insert a needle to then release that air, correct?
Yes.
And I think it's kind of obvious, the preferred way is to have it resolve naturally, correct?
Absolutely.
And that's what happened here.
Yes.
All right, so kind of at this point, just because she's admitted, there wasn't a probability of death absent medical intervention, fair?
Fair.
There was no indication of permanent loss of lung function, correct?
Yes.
Or esophagus, trachea, no long-term disfigurement, correct?
Correct.
and no permanent loss or impairment of her function, correct?
Correct.
Okay. So this was an issue that was identified, it was observed, and it resolved on its own. Fair?
Fair.
Okay. Nothing further.
Ms. Stone, any further cross-examination?
Very briefly, Your Honor, thank you. Dr. Stankus, I just want to be clear. Admission is precautionary, but you don't admit most patients to the hospital that come into the ER, right? I mean, fair to say you see hundreds or thousands of patients a year in the ER.
Correct. So we call for admission and a hospitalist or a surgeon will admit the patient.
And in this case, Fatima needed medical admission and medical whether how that condition is treated before you know the outcome either. Fair? Meaning because it went well for her doesn't mean that's how you decided whether it was a condition that needed observation or not.
Yeah, so anytime we admit someone for observation, whether it's chest pain or, in this case, pneumomediastinum or airway precautions, that condition may or may not, the thing that we are worried about may or may not happen, but we still admit them to make sure that it doesn't, or if it does, to intervene as needed.
Sure, and as you reviewed those medical reports for Fatima, when counsel, I believe Mr. Leary just asked you about, you didn't see any indication of a permanent injury, and the outcome of the pneumomediastinum wasn't a probability of death. The pneumomediastinum itself, is that correct? I mean, you said no, you agreed with him that was not a probability of death based on the pneumomediastinum itself. You agree?
Yes.
Okay. But the pneumomediastinum was accompanied by strangulation, and strangulation itself can result in death. You agree with that?
Strangulation can result in death.
And Fatima didn't show up at the ER with a skinned knee and a bruise on her thigh. You agree with that after reviewing the medical reports?
Yes.
Thank you. I have no further questions.
Mr. Kadeen Rebrecross?
Yes, just one point of clarification, if I may. So, doctor, let's say that I have a hangnail and it gets a bad infection and it spreads up my arm and goes to my heart and kills me. Can that happen?
It can.
Okay, no further questions, thank you.
Mr. Leary, anything further? All right, anything further, Ms. Stone?
Are you admitting the person with the hangnail, doctor?
If they have evidence of that spreading infection up their arm, they may be admitted for IV antibiotics to make sure that they're responding to it.
Sure, when there's an indication that something has gone significantly different than a normal hangnail. Is that fair to say?
Correct.
Thank you.
Mr. Kadeen?
No more, thank you.
And may this witness be excused?
Yes, sir.
Any objection, Mr. Larry? No. Ms. Stone?
No, Your Honor, thank you.
Thank you. Dr. Stickis, thank you very much. You are excused and you may step down. Members of the jury, we are going to recess at this time, and as you know, we are not in session on Friday, and so we are going to resume the presentation of evidence on Monday.
I know she had y'all in the tizzy. Sorry, y'all. I'm playing around with my school schedule, so I kind of spaced out for a minute. But y'all remember Nicole, right? Y'all remember Nicole? We was watching Nicole yesterday. We had watched a bit of their opening arguments. We watched the detective get on the stand and talk about how Nicole, the senator, broke into, her. She broke into her who was it? Her stepmother's house. Well, shout out to Che, because Che found the Minneapolis St. Paul Fox YouTube channel, and y'all, they got the trial. They got the trial. So we are actually going to start catching up on Nicole's trial. She's on day 5. This is going to be day 2. All right. I think we were watching the officer testify. And so I'm going to jump back over to his testimony if you missed it. It was only like 10 minutes, right? Yeah, it was only like 10 minutes. So maybe we can skip right. Well, he said some interesting things. I'm not even gonna hold you. So we're gonna go ahead and play He's Over, and then we're gonna let it play into the thing. All right, y'all. So here we go.
Spell your last name.
Joseph Daniel Sternhagen, Sternhagen.
Sir, where are you currently employed?
City of Detroit Lakes Police Department.
And what is your current job title?
Current?
Current.
Investigator.
What was your job title in April of 2024?
Patrol officer.
How long have you been a licensed peace officer in the state of Minnesota?
Since 2010.
Would you please outline your educational background?
I have a 4-year degree in law enforcement. And then my continuing education every 3 years. I meet the requirements for hours.
Where did you get your degree from?
Mankato State University.
Do you have prior law enforcement experience before joining the Detroit Lakes Force?
Yes, I worked for the BIA, Bureau of Indian Affairs at Standing Rock, and then City of LeSueur.
Officer Sternhagen, what did you do prior to joining law enforcement?
I was in the Army.
You're a veteran?
Yes,
Are you retired or still active?
I'm retired.
Were you deployed, sir?
Yes, I was.
How many tours?
Just one tour in 2005 to Iraq.
So in 2024, you were a patrol officer?
Yes.
As
What date? Sorry.
I'm sorry, in April 2024?
Yes.
Apologize for interrupting. Officer Sternhagen, what do your duties consist of as a patrol officer?
Force traffic and criminal law in City of Detroit Lakes. So,
Sir, were you working on April 22nd, 2024?
yes, I was.
Do you recall what shift you would have been assigned to?
The 6 p.m. to 6 a.m. shift.
Do you recall being dispatched to a burglary call that morning?
Yes.
Where was the location of that call?
It was on Ranger Road. I don't remember the exact address. So,
Is it here in the city of Detroit Lakes?
yes, it was.
In Becker County?
Yes, it was.
Officer Sternhagen, to the best of your recollection, can you walk us through your response that morning?
There's a call of an active burglary to the residence on Granger, and I responded. My partner got before me, and I entered the house. I could hear him yelling, "Show me your hands." He was on the stairs. I walked downstairs. The caller stated, and my partner stated they could hear the person under the stairs. So,
Some rustling, is that fair to say?
yes.
Okay. And when you refer to your partner, who is that?
Officer Ethan Woothie.
Okay. So what happened next?
Searched underneath the stairs first, and then I came back through the hallway, and the door was open to the bathroom, which wasn't previously open when I first walked by. And then I saw a female dressed all in black with their hands up like this.
Okay. Were you later able to ascertain who that female was?
Yes.
Okay. What name or what was her identity?
Nicole Mitchell. Nicole Lynn Mitchell, actually. So,
Saw Miss Mitchell again. Would you recognize her?
yes.
Do you see her in the courtroom here today?
Yes.
Can you outline where she's seated and what she's wearing?
She's wearing a purple shirt, and can't really tell what pants, black or gray pants.
Your Honor, can the record reflect the witnesses identified the defendant?
The record will so reflect.
Okay. So what happened as you first detained that individual?
I ordered her to the ground. Officer Ethan Woothie handcuffed her, and then helped her up and asked her if she had anything on her.
Prior to her even getting off the ground, did she make any statements?
Yes.
Okay, what did she say at that time?
When she was on the ground, she said, "Carol, it's me, Nicole."
And Officer Sternhagen, this entire encounter was recorded on body camera, is that fair to say?
That's correct.
And you're doing your best to remember here this morning, but
Yes.
Whatever's on the recording is what transpired and what was said. Is that fair to say?
That's correct.
Okay. Did you recover any items from her at that time?
Yes.
Can you tell us about that?
She said she had a flashlight in her waistband and she grabbed it from behind her and then it fell to the ground. It was a flashlight with a sock over the top, over the lens, attached by a rubber band, secured by a rubber band.
May I approach the witness, Your Honor? Officer Sternhagen, I'm showing you what's been marked as Exhibit 2. Do you recognize this?
Yes, I do.
Can you tell us what this is?
That's the flashlight that she pulled out of her waistband.
Your Honor, I'd offer Exhibit 2.
No objection, Your Honor. Exhibit 2 is received. You can just set it right there.
Thank you. So at this point, the defendant is detained, is that correct?
That's correct.
And where did you walk to next?
Into the living room. And then she said she wanted to get some shoes.
Okay, was that, did that strike you as unusual?
Yes,
So she did not have her shoes on at that time?
she did not.
Okay, and where did she recover her shoes from?
They were under the couch. I let her first try to get them, but she was handcuffed. So she pushed them further underneath with her feet when she was trying to get them on. So
Does the defendant continue to talk during this time?
she does.
Okay, what else did she say?
I don't remember the exact order, but clearly I'm not good at this, and I'm a military commander, for God's sake.
Was the homeowner present as you were detaining the defendant?
Yes, she was.
Okay, was that a brief time period?
Yes.
And eventually the parties were separated, is that accurate?
Yes.
Where was the defendant led to next?
I walked her upstairs and then outside to my squad car.
What did you do once she was in your squad car?
I made sure her cuffs were properly fitted and she was comfortable, and then I read her Miranda rights.
Was she willing to speak to you at that time?
Yes.
To the best of your recollection, can you summarize what the defendant told you at that time?
She was upset with the relationship with her stepmother. Her stepmother stopped speaking to her. She left her house in Woodbury at 1 a.m. to come to the residence in Detroit Lakes to get some of her father's items. Ashes, a flannel shirt, and other mementos, she said. She said she entered through a window in the backyard. She said it's where the backpack was. But I never made it to the backyard to see where actually she made entry. So
Your immediate response was to get in the home and find the individual, is that fair to say?
yes,
So you were never tasked with canvassing the yard or the house?
no,
Did she reference, did the defendant reference her, her stepmother's condition at that time?
she says she had advanced Alzheimer's.
At any point during that statement, did the defendant say that she was concerned or that's why she was at the residence?
Never, she never said that.
At some point, did you ask the defendant when the last time she talked to the homeowner, Miss Mitchell, was?
Yes, I believe she said October, November.
Just to clarify, Did she differentiate between the last time she was at the house and when the last time they actually communicated?
I can't, without seeing my report, can't
Okay.
clearly answer that.
Would the, again, the statement would be accurate on your body camera recording?
Yes.
Did the defendant, was anything of the defendant's recovered from the scene?
The backpack was propped in the back window.
Did she say that was her backpack?
Yes.
Were you in charge of going through that backpack?
No.
Who processed the backpack?
Officer Woothie.
Where did you go next, Officer Sternhagen?
I transported her to the Becker County Jail.
She was booked in, is that correct?
That's correct.
Did you continue to converse with her?
Yes.
Okay. What did she tell you at the jail?
Well, I asked her what got her to this point, and she said it's been her father's possessions have been weighing on her, and it's been hard for her to sleep, and that's what drove her to this point.
At any point in your conversations with the defendant at the jail, did she ever express concern over her stepmother's well-being?
No.
At any point throughout that entire interaction, whether at the house or at the jail, did the defendant state that she was there to, quote, check on Carol Mitchell?
No.
At any point throughout your entire interaction with the defendant, did she state anything about medical information that she found out about Carol Mitchell?
No, she did not.
And Officer Sternhagen, you were equipped with a body-worn camera that early morning?
Yes, I was.
Okay, this entire encounter was recorded?
It was.
Okay. Did you have a chance to review said recording prior to court today?
Yes.
Was there a slight edit for efficiency reasons?
Yes, there was.
And what was that?
The drive from the house to jail.
And just to be clear, did the defendant make any statements during that drive?
No, she did not.
If I told you that your body camera footage was in the court's exhibit system as Exhibit 7, would you have any reason to doubt me?
No, I would not.
And you had a chance to review that prior today?
Yes,
And was it true and accurate?
it was.
Your Honor, I'd offer Exhibit 7 at this time.
Objection, Your Honor. Okay. Exhibit 7 is received.
Can we approach, Your Honor?
You may.
Took this break. It's going to come right up immediately to this body camera video being shown in court in Becker County Court. Again, Detroit Lakes is the city, but Becker County is the county seat. It is their prosecutor that is charging and prosecuting this case. Again, started about a little less than 2 hours ago, but here it is.
The witnesses' videos are.
you want to utilize my partner or not?
Sound for it. 30 Becker, I'll be on.
Good work. Nose. 10-4, 33 traffic to the north of the house. 10-4, Becker will be 33 traffic coming in.
30 to 37, I didn't copy. What's going on?
Still in the house. A lot of motion underneath the stairs. Sounds like he's trying to get outside through a window.
Sound for it. Where to?
He's the other officer downstairs. I'm trying to see. Kind of bit off.
Hey, watch out. Where'd you at? Police department. Underneath the stairs.
So it's in motion now? Motion.
Is there a way to get underneath the stairs?
Becker 05, if you come up long, looks like there's a long driveway right to the back of the residence.
Another bathroom. There.
Get on the ground. Hands behind your back.
There's some back room, take a vote. That's all, 451.
Carol? Yeah? It's Nicole. It's Nicole?
Oh, come on.
I was just trying to get a hold of my dad's things because he wouldn't talk to me anymore.
She stole documents out of the house. She's my stepdaughter.
I didn't steal any documents. How did I steal documents?
Cool, what's your last name?
Mitchell.
You had your Aunt Nancy do it.
30 Becker, Route
No one
1015.
did anything.
Was there Nicole Mitchell in the house?
Stand up. Check it.
No one
on you?
stole anything, Carol. I don't have anything on
Take
me.
her out if you want to talk to her.
Not tonight.
Got anything on you?
No. I have a flashlight. That's it.
Go ahead.
Oh, transitioning right here for 1015.
10-4, or 10-15. Becker, you can clear 10-33.
10-4, clear 1033 at 452. And I see a Nicole Mitchell in-house.
Is it Mitchell?
Mitchell.
Mitchell? Mitchell. What's your date of birth?
10-4, not finding one then.
Huh?
10-10-1974.
10-10-1974. You got a middle name?
Lynn.
Middle name Lynn. Anything else in here? Did you
No,
drop
there's
anything
not.
else?
No,
Okay.
sir.
All right.
She's gonna do what she's gonna do.
Okay.
My dad died last year. She's paranoid. Well, now she's really paranoid. But can I just grab my shoes?
Where are your shoes at?
Just under the thing. Just under the. No one has stolen anything from her, and I know this sounds weird. I mean, from a person in handcuffs, but
Here, why don't you get up? I'll grab them for you.
you're black.
Have a seat.
Oh, you're just stuck under there.
38, we got it.
Don't worry, thank you. Why are your shoes stuck all the way on it?
Well, because I was trying to get him with my teeth. What about? I have never done anything like this. You're gonna find it out. I'm a military commander, for God's sakes.
Okay.
She's got severe Alzheimer, and there were just a couple things in my dad's I wanted to come get. Because when everyone tried to help her right after the funeral,
She's trying to get money.
she kept, I can show you my bank account.
Well, let's go upstairs.
Have extensive resources. Obviously, I'm not good at this.
All right, let's go out the front door here.
After the, I'm sorry, are we leaving?
Yeah, we'll go to my car here quickly. I'll let you sit down. Go ahead. This one.
Can you confirm that name one more time?
Come over here. Stand by. No, not in front.
Oh, I'm sorry.
I got it. They don't give us automatic locks.
That's okay.
All right, have a seat. Are those tight? Hold on. Get up. You just want to make sure they're locked so they don't tighten up on you. Yeah. Hold on. All right, turn around. That better?
That's better. I appreciate it.
That hurt? Sorry.
No, I'm just too thirsty.
Okay.
This is not my normal life.
Restarting, pulls out window.
Okay, hold on a second. So you're in custody. I'm going to read you your Miranda rights, okay?
I also noticed a hammer on the steps around the school building room.
What?
Okay, what's you say your first name is again? Nicole. Nicole, you have the right to remain silent. Anything you can say can and will be used.
3705, where did you say that hammer was?
You in court. You have the right to talk to a lawyer
Last step before the door.
and to have the lawyer present now or at any time during questioning. If you cannot afford a lawyer, one will be appointed for you without cost. Do you understand each of these rights I've just explained to you?
I do.
Having these rights in mind, do you wish to talk to me now?
I'm just hoping, this mistake won't completely fuck up my life.
So,
I know, I did something bad.
do you wish to talk?
After the funeral, my aunts tried to help her. She thinks they stole from her when they were just trying to get her affairs in order.
Okay.
She has progressively cut off the family to include promising us some ashes that so we could bury them with the rest of the family.
Can I stop you quick? What's your relationship to her?
Stepmother.
Stepmother? Okay.
But she's got Alzheimer's and she's gotten, I know this doesn't help, this
Yeah.
is just going to prove the point, but she's gotten paranoid and thinks we're all out to get her and won't let anyone in the house. And I just wanted to get a couple of my dad's mementos. And that's all.
Okay. So what kind of mementos?
a couple pictures, and maybe one of his shirts.
One of his what?
One of his flannel shirts.
Okay. And then, how'd you get in the house tonight? Yep.
That window
The window? Okay, which window?
where the bag was.
Or the bag? I didn't go back there, found it, so I'm just... So, what's in the bag?
A couple laptops.
Your laptops or someone else's?
My laptops.
Okay. Nothing else in there?
Water.
Water? Did you park? Yeah. Did you park or anything?
Yeah, I parked over on the side street.
Okay, what kind of car is it?
A Prius.
Prius? Okay. Alright, so you got through the basement window? I haven't been back there yet, so. And you're doing it, so this used to be your
37, do you have Carolyn?
Yeah, I used to be here all the time.
Okay, when's the last time you were here?
Yeah, well, I got the RP Carol.
Last time I was here,
Unable to locate the name, I was previously given her the suspect.
October and November,
Okay.
and then she just got progressively more paranoid.
Gotcha.
Becker 6100 units, another active bird, 103 Rivercrest Drive.
So I thought there was
Hold on.
Okay. So what got you to this stage where you thought this was...
Oh, 5 out clear, gotcha.
the ashes, I think.
The ashes?
Scene record, what do you got?
Gotcha.
Active bird, 103 Rivercrest Drive,
My
apartment 23.
aunt's, my cousin had died in November, and my aunt drove all the way out here to get the ashes per an agreement,
Okay.
just to get here to be told, no, never mind. And that was really devastating for everyone not to even have the ashes.
Okay. And so you're here to get...
A couple moments.
You said pictures, shirt, and ashes?
Well, the ashes got buried before anyone got them.
Do you have more info on those burglary?
I just wanted to get a couple of things before anything else gets...
Have you tried to talk to her before this?
RP, it sounds like an ex-boyfriend, possible PTSD.
We had a fight over the ashes situation, and she at least right now, wouldn't talk to me. It's just gotten progressively worse.
How long has it been since you last talked to her?
Month.
Month? Okay. All right, so right now you're under arrest for burglary, okay?
Even if I didn't take anything?
So you broke in the house with the intent to commit a crime, so that's burglary. So, okay, I mean, you're definitely dressed for it. I mean, I understand your situation, but you still can't. I mean, there's other ways to try to go through it. So, I apologize for the situation you're in and stuff. But, okay.
My military retirement.
Nicole Lynn,
Yeah.
Lynn.
Yeah.
And then last name again? Mitchell?
C-H-E-L.
Mitchell.
Yes.
And your date of birth?
10-10-1974.
10/10/74? Okay. Okay, you want to put your feet in?
100 units. The suspect is partway through the door, off and on, trying to get in. The ex-boyfriend, PTSD, not in the right mind.
Means anything, but she's a state senator.
All right.
That's for it, you know,
so I'll run this since they're busy, so.
My caller has a knife. No mention of weapon of the suspect.
She's got a Prius parked that way. There's keys there. Okay. So I tried looking for it. There's 2 laptops in there, so I'm gonna go ask her if one of them are hers, but I didn't find anything.
Okay, where does that found at?
This was found in the window she came in.
Okay. Did you get a picture of the window and everything?
Yep.
The hammer's not really.
The hammer's not hers.
Okay.
Mom said that was hers for protection because she woke up in bed and she was laying by her bed.
She was?
Yeah.
Oh, well. She ran downstairs on it?
She ran downstairs. And then when I got up the stairs, I heard a bunch of rustling. So.
Yeah, it sounds like your kids are
I
there.
didn't find anything dangerous in there.
Okay. I'll ask her about the laptop.
I'll run this.
Tail has the one that goes from start away just in case. Or try trio on the outside. Nicole, I got your bag up here, okay? Hold 5, it'll be that second building there, top floor. She said her Prius is, she said parked around the corner, so you just want to get that. What's going on? Yeah. You got her at it?
Yep.
Go ahead. 32 will make its way in. 10-4. Oh, wrong side. No, for me. And right through that door, okay? All 5, does she know what door he left? She didn't see any way that she ran. The victim's also saying that there's no residency here in 24. The door is usually open, but it's locked down, so. Yeah, it's lettuce, it looks like. I'll see if I remember the code for the master key. Becker. We have a suspect name for the freight vehicle call. Sugar. The Harbury Ross. In-house for Breaker Ware. Give me his date of birth, please. Date of birth, 7/1/75. If you're going back there, I'll be 10-8. 10-4.
Can I ask what the process is?
I'm gonna get booked in here, and as chances are, I'd be under influence of any drugs or alcohol tonight. So you'll probably be seeing a court today, sometime, or tomorrow for sure. So, okay. So. That's up to the attorneys, so I don't handle that stuff. So you have to initial hearing.
Is someone who begins her to drop charges? Is that a thing?
No, I don't. I'll have to look at that again on the side. What degree? Okay. All right, Nicole, I gotta ask you some questions, okay? And some of them are kind of ridiculous. Are you a predatory offender? Are you a veteran? Have you been involved in a motor vehicle crash in the last 24 hours? Are you pregnant? Suicidal?
So I bet the first building number 1 is clear. 10-4.
hers too? Yeah, I'm debating if I keep this. Yeah, I'll probably will.
All right. Good rest of the night.
Yeah. Is there anything you'd like to?
I don't know if you're allowed to give it to me. There is water in the back, but there's any like.
They'll get you some water when they need.
Yeah, we'll get you one.
Okay, so yeah, either today or tomorrow. I don't know if we'll have time to get our reports done in time. We'll see. But okay, but then do we see in court?
Today would be amazing.
Yeah.
Kids.
Okay. Did you drive all the way up from Woodbury tonight, or did you have to stay someplace? Okay. What time did you leave at?
Get this master key. Sounds like there's one apartment out there that we're gonna check.
So what drove you over the edge tonight? Yeah. All of a sudden you're just like, I got it.
As I said, it's
Outside
just
by the office.
it's waiting. Especially this
41.
past month.
Good morning, I'll be turning amendments and we have anything for me.
A lot of sleepless nights.
How you doing? Just call a car. Okay.
Couldn't sleep and thought about it.
And how often have you talked to your stepmom, right?
As I said, since the ashes was found.
Okay. Gotcha. That's been about a month? All right.
Actually, yeah. His anniversary of his death was March 19th. So,
Okay. And then how long has she been your stepmom for?
40 years.
40 years? Okay, so you know her for a long time.
Yeah, since I was
4?
4.
Gotcha.
Wasn't having another kid. She was up for adoption, but she didn't. Or grandchildren.
Okay, well, I'll include all this stuff in here. Like, again, I understand your situation, but I'm just...
I'm
So just based on the way you're dressed and your flashlight, and then it looked like you thought this through quite a bit. So, and then driving all the way up, and then... So... Okay. So, well, like I said, I'll try to get this report started as soon as I can, so...
Okay. I'm ready to hear.
In fairness, I would have been blocked. I said in fairness, I would have been blocked.
Oh, okay, gotcha.
We'll move on, please. And they'll come get you as soon as you can. Maybe a little while. But yeah, there's water there. What's that? Yep.
Officer Stirring, just a few follow-up items from that. There was some discussion when the defendant was in your squad about a hammer. Can you tell us about that?
There's just something that was found on the stairs. I don't know much about it. I never saw it.
But you have no reason to believe that that was the defendant's hammer, fair to say?
Yes.
In fact, I think the radio traffic made it clear that it was Carol Mitchell's for defense.
Yes.
We saw you packing up a backpack on the video. Did you initially inventory that?
No, I did not.
Okay, and who did that?
Officer Boothie.
Okay. Did you photograph the flashlight that we've already received into evidence?
Yes, I did.
Officer Sternhagen, I'm going to show you what's been marked as Exhibit 3. Oops. Is this a true and accurate photograph of the flashlight you took?
Yes, it is.
Is this after you had switched on the flashlight?
Yes,
And why did you do that?
to show that the sock was used in a manner to affect the way the light was being emitted from the flashlight.
Your Honor, I'm a little out of order here, but I'm going to offer Exhibit 3 at this time.
I have no objection, Your Honor. Exhibit 3 is received.
Since it's been published already, I will take it down. Can we disconnect my laptop or? There we go. Officer Sternhagen, when you had officially arrived at the jail and the process was started, the defendant, is it true the defendant asked you, quote, can someone convince her to drop charges?
Yes,
And when you questioned the defendant at the jail, obviously Carol Mitchell was not present. Is that correct?
no, she was not.
When you questioned the defendant in the back of your squad, Carol Mitchell was not present. Is that correct?
That's correct.
Officer Sternhagen, you told us you're a veteran.
Yes,
How did it make you feel when the defendant disclosed?
Objection, Your Honor. Finish the question,
Finish the question.
if you would.
Officer Sternhagen, how did it make you feel when the defendant disclosed to you that she was a military commander?
Here, hang on. Oh, sorry. Your objection, Mr. Engstrom? It's an opinion not relevant to the elements in this case, Your Honor. Sustained.
I have no further questions, Officer Sternhagen.
Mr. Engstrom? Thank you, Your Honor. Good morning, Investigator Sternhagen.
morning.
Investigator Sternhagen, Mr. McDonald asked you a question. I want to ask it again just to make sure that we're clear. You've recounted what you've seen on the body cameras. If the body camera reflects something that's slightly different from what you testified to, are you comfortable saying that what the jury sees in the body camera should be treated as what actually happened?
Can you repeat the question, I guess?
You've watched your body camera?
Yes.
Before? Okay. And if some little twist of what a word was or what was said is different than the way you testified, should someone trust what's on the body camera rather than what you may have testified?
Yeah, trust what's on the body. That's what happened on the body camera. So.
Yes, sir. When you came up to the bathroom where Nicole Mitchell was would it be fair to say that the door of the bathroom opened as you were approaching it?
It was closed when I first passed it, and then I noticed it opened, and I remembered it not being open when I first walked past it.
And you did not push that door open, it simply was opened when you passed it again, correct?
That is correct.
All right. When Nicole Mitchell asked you about her shoes, you had testified, I think we saw in the video, that they were underneath a couch.
Yes.
Where was that couch in relation to the windows in the basement?
I never looked at the windows to the basement, so I couldn't tell you where Exactly.
When you, first Nicole Mitchell tried to retrieve them herself, and then
Yep.
you assisted her, was there a window against the wall right there by the couch?
Like I said, I wouldn't be able to recall. I didn't look at entry points or exit points at all during the call or after.
So you wouldn't know whether those shoes were right next to a window where Nicole Mitchell may have come into the residence?
No, I would not know.
Okay. Your body camera appears to reflect that Carol Mitchell, the homeowner, actually came down right behind you while you were still investigating. Is that accurate?
I don't know. She came down right behind me. I was talking to the defendant for a few minutes before she came down.
Okay. And just like with my previous question, if your body camera reflects something different than what you just said, we should go with the body camera shows, correct?
Correct.
The body camera shows that Carol Mitchell was down there when you were actually in the laundry room before. As long as the video shows that, you wouldn't dispute that, correct?
Correct.
The initial search that you conduct of Nicole Mitchell, is that simply like an officer safety type search?
Yes,
Okay. And during that search, that's when you find the flashlight?
that's correct.
During that
Well, let me
search,
rephrase. I didn't find it. I asked her if she had anything on her, and she pulled it out of her waistband.
she told you what it was and produced it for you?
Yes.
At that time, did she have any other obvious possessions on her person?
She did not say that she had anything else on her.
Okay. And between that moment and the point that you brought her into the squad car, did you conduct some more of a careful search to ensure she didn't have contraband or anything dangerous on her?
No, I did not. Usually with female, we do a search for weapons, and then they do a more thorough search up at the jail. So,
With the search for weapons and then a more thorough search for the jail, were there any personal possessions from the residence that were discovered on Nicole?
no, there was not.
You did not conduct the full inventory of the backpack, but we do see on your video, you do handle it and you unzip it, is that correct?
Yes, I was putting stuff back in.
Very good. Did you put anything back in there that your understanding came from the residence?
I couldn't tell you what came from the residence and what didn't. So.
Okay. You had asked Nicole Mitchell what got her to this point, and I believe she says the ashes, is that correct?
Something to that effect, yes.
Did she say something to the effect that she was there to get ashes?
Yeah, she said she was there for the ashes. Yes. And also a flannel shirt and pictures.
Right.
So.
And as far as the ashes, you asked her about that, and she said that she actually knew the ashes were already gone. You recall that?
She did say that at the car, yeah.
Okay. You had testified on direct examination that Ms. Mitchell did not express concern for Carol Mitchell. Would it be fair to say on the body camera that we just watched, she said that my dad died last year, she's paranoid, Carol Mitchell's paranoid, and now she's really paranoid. Is that a fair statement?
Yes.
Would it be fair that Nicole Mitchell said she, again referring to Carol Mitchell, has got severe Alzheimer's? I'm not asking whether you think it's true that she has severe Alzheimer's. I'm asking whether that's what she said in your presence when you were
Yeah,
interviewed.
she said that.
Okay. Did Nicole Mitchell say that she, again, Carol Mitchell, has gotten paranoid, thinks we're all out to get her? And won't let anyone in the house?
Yes.
Did Nicole Mitchell say that I used to be here all the time, and then she just got progressively more paranoid?
That's correct, but she said the last time she was there was October or November.
Yes, sir. And then there was at least one more exchange about the ashes, that there was a fight over the ashes, and now Carol Mitchell wouldn't talk to her anymore. Do you recall that?
Yes.
Okay. Investigator Sternhagen, are you the case agent in this case?
No, I'm not.
Have you applied for any search warrants for this case? Have you contacted me about this case?
No, I have not.
Thank you, Investigator Sternhagen. I have no further questions.
Mr. McDonald.
Investigator Sternhagen, do you recall an exchange with the defendant where you told her, quote, there are other ways to go through it?
Yes.
Okay, what did you mean by that?
There's a process, courts or other family members to get the stuff that she wanted to get.
You're familiar with your agency's record system, is that fair to say?
Yes.
Within the preceding week or so, are you aware of any request for a welfare check by the defendant on Carol Mitchell?
No.
Let me ask it another way. Does any such request exist?
No, it does not.
I have no further questions.
Mr. Ringstrom.
No questions, Your Honor.
Okay, investigator may step down. Your next witness, Mr. McDonald.
Your Honor, the state would call Carol Mitchell.
You're watching the tape delayed here stream of the trial of State Senator Nicole Mitchell up in Becker County. And we have to take a break now because the state has called Carol Mitchell, Nicole's stepmother, and the occupant and owner of the home that she entered the night in question back in April of last year. She's opted not to be on camera, which witnesses can do. So we got to take a break because we can't show or even hear any part of her testimony. But what we've been hearing here for quite a while is Officer Joe Sternhagen of the Detroit Lakes Police Department testifying about responding to the 911 call. And then we saw lengthy body camera video of him driving there, entering his interactions with Nicole Mitchell, taking her out to his squad car. And then it did not show the portion of driving to the police station, but we cut to her being brought into the police station in Detroit Lakes and further conversations that they had there inside the police department, in which she does speak quite a bit about what she was doing there and her concerns for her stepmother.
And she opens up about it. I know we want to get to that break. My knee-jerk reaction watching it with you and then our viewers, the body camera, it is an intimate situation, isn't it? It's a family situation. It's quickly established that it is. The police response is such. They kind of almost at one point I remember hearing Sternhagen on one of the voices off camera, kind of apologizing in the moment to Mitchell, and you wonder just it's taking a step back, and they would tell her the way you're dressed, how far you drove, what's going on here. We have to move forward with a burglary arrest, but had some of those circumstances been even slightly different, you wonder if police could have may have handled it differently. But you feel, Carol, the stepmother, is walking around. She's like, oh, she's here to get money or whatever the phrasing was. But police obviously quickly realized this is something going on in the house. This is not a cat burglar. This is not somebody who was
It's
trying
not a stranger.
Yeah.
And she immediately talked about her concern for her stepmother's declining maybe health state, mental state, but also the breakdown in their relationship, that she wasn't letting anyone in. And then you heard Carol Mitchell say, she wants money. We're going to take a quick break in our all-day coverage here. We'll be back in a couple of minutes to further break down what we saw in this body camera video and hopefully speak to Marsh Hallberg, defense attorney, again, about his thoughts on what that presents, both for the prosecution and for the defense. We'll be right back here on All Day. Former
Publishing Exhibit 8.
County Sheriff's Office now taking the stand.
Good afternoon.
Afternoon.
Can you please state your full name for the record and spell your last name?
Leah Honer, Honer.
Ms. Honer, where are you employed?
The Becker County Sheriff's Office.
And what is your current job title?
Deputy.
Ms. Honer, where were you employed in April of last year, 2024?
At the Becker County Jail.
And what was your job title there?
Correctional Officer.
As a correctional officer, what are your duties?
Like, maintain safety and well-being of the inmates, doing well-being checks, when officers bring people into jail, doing the initial pat search, and then end up booking them in on their charges.
Ms. Honer, do you have a document in your hand?
Yes.
Can you please make sure it's turned over and that you're testifying from memory and not any paper?
It's turned over.
Thank you. So you just told us what your duties were as a corrections officer, is that correct?
Yes.
Okay. Were you working in the early morning hours of April 22nd, 2024?
Yes.
At the Becker County Jail?
Correct.
Do you recall what shift you would have been working?
The overnight shift.
Do you recall a female suspect named Nicole Mitchell coming into custody that morning?
Yes.
Did you assist with the booking process involving the defendant?
Yes.
Excuse me, involving Ms. Mitchell?
Yes.
Can you please walk us through and explain what occurred as you booked in the defendant?
Well, when the defendant walked into the pre-booking area, that's where we were met by the arresting officer. I then instructed her to go towards the wall. We have like a brick wall with 2 red handprints on the wall, and to face the wall as she was handcuffed. Then I performed my pre-search, just looking for any like bulky weapons or any other bulky items on her person. Then once I didn't find anything of sort in that, I asked if she would comply if I took the handcuffs off. She stated she would. And then I performed more of a in-depth pat search.
When you performed that in-depth search, did you locate any items?
Yes.
Did the defendant tell you what they were, what it was?
Yes.
What did she say at that time?
A flashlight.
Was this a traditional flashlight?
No.
Where were those gloves placed after you took them?
I then handed them to Correctional Officer Eric.
Ms. Honer, is the booking room equipped with video recording equipment?
Yes.
Was this encounter recorded?
Yes.
Did you have a chance to review that booking video prior to today?
Yes.
Is it, was it modified down for efficiency reasons?
Yes.
Okay. Was the version you reviewed true and accurate to the best of your knowledge?
Yes.
I told you that it was marked Exhibit 8 in the court's exhibit system. Would you have any reason to doubt me?
No.
Your Honor, I would offer Exhibit 8 at this time.
No objection, Your Honor. Exhibit 8 is received.
Would ask to publish, Your Honor.
You may.
Now publishing Exhibit 8. Ms. Honer, is it accurate to say those gloves were placed on the counter then?
Yes.
Okay. Do you know, and only if you know, was Officer Sternhagen advised of those gloves?
I do not recall.
After the defendant was booked and later on, did you have a chance to obtain some still photographs of those gloves?
I do not.
You did not?
No.
Okay. Did you and your team at any point research what you believe that item to be?
Yes.
And what did you do? How did you research it?
I did just a basic Google search.
Okay, and what did you discover?
That it appeared to be relatively the same object.
Ms. Honer, I'm showing you what's been marked as Exhibit 9. Is that appearing on your screen?
Oh.
Whoops. there. I'm showing you what's been marked as Exhibit 9. Do you see that on your screen?
Yes.
Okay. Is that the website or a picture of the website that you researched?
Yes.
Is that a true and accurate photograph of what you found?
Yes.
Your Honor, I'd offer Exhibit 9.
No objection.
Exhibit 9 is received.
Asked to publish briefly, Your Honor.
You may.
And again, Ms. Honer, this appeared consistent with the item you removed from the defendant?
Yes.
That's it for the exhibit, Your Honor. Finally, Ms. Honer, I'm showing you what's been marked as Exhibit 13. Just one moment. Okay. Is that exhibit now on your screen?
Yes.
Okay. Can you tell us what this is?
An Amazon receipt.
Did you have a chance to review this receipt prior to court?
Yes.
Okay. And were you advised of where this came from?
Yes.
Can you tell us where?
The defendant's attorney.
Is this a true and accurate copy of that receipt that you reviewed prior to court?
Yes.
Your Honor, I'd offer Exhibit 13.
No objection. Exhibit 13 is received.
Asked to publish briefly, Your Honor.
You may.
Ms. Honer, could you tell us what the second item listed on that receipt is titled? Just the first part of it.
The second item?
Yes, the second item.
That would be the toilet bowl cleaner with handle.
I'm sorry, the third item. Forgive me.
That would be the Mopi Joe LED flashlight gloves. Gifts for men, him, dad, or boyfriend.
And the apparent date on this receipt?
February 26, 2023.
Thank you. Ms. Honer, was your involvement in booking the defendant, did that conclude your involvement with this case?
Yes.
No further questions, Your Honor.
Mr. Ringstrom.
Thank you, Your Honor. Good afternoon, Deputy Honer.
Afternoon.
You broke down your search into a pre-search and a full search. Were you the only female correction officer on duty at that time?
Yes.
Okay. So how detailed is a full search in that context?
That's going over like the waistband multiple times. They're wearing leggings. Sometimes leggings have a pocket on the inside, so you go feel through the leggings with your fingers and your hands, and then with that you're basically just feeling over pretty much every like limb and more in depth.
Sure. And so when somebody is arrested, they don't have the same right to privacy. It's your job to be kind of physically intrusive and check very carefully. Is that a fair statement?
Yes.
In the process of doing the full search, did you find that Nicole Mitchell had any other like garments under her normal garments? I mean, like, was she wearing an extra pair of pants or shorts underneath her leggings?
I do not recall.
Okay. If she had been, would you expect to have put that in your report?
Yes.
Was she wearing any men's clothing underneath the clothing that we saw in the video?
Not that I was aware of.
Okay. Did you see a flannel shirt?
No.
Okay. Besides the flashlight and her jewelry, and I guess what was the jewelry in question?
I do not recall.
Okay. Besides the flashlight and jewelry, was there anything else that you removed from Nicole Mitchell?
Her shoes.
Her shoes. Okay. And did those shoes appear to fit her feet? That is to say, they didn't seem that they were somebody else's shoes?
They appeared to fit.
Okay. Deputy Honer, did you take a picture of the actual flashlight glove when it was in the booking room?
I did not.
Deputy Honer, did you generate a report after someone else asked you to do so?
I did.
And was there also a correction officer, Eric Scott, in that room at the time?
Yes.
And you could see him? Did we see him on that video?
Yes.
Okay. So it's clear that he was interacting with Nicole Mitchell at that time as well?
Yes.
Okay. Thank you, Deputy Honer. I have no further questions.
Mr. McDonald?
Ms. Honer, are you aware, do you know if those flashlight gloves were retained?
I don't understand.
Do you know what became of those flashlight gloves that were recovered?
When I left the pre-booking area, I went and resumed my post at Rover, which is on the opposite side of the building.
So do you or do you not know what happened to those gloves?
I do not.
Okay, thank you. No further questions.
Mr. Engstrom?
Nothing, Your Honor.
Deputy, you may step down.
All right, that is continuing coverage here of the trial of State Senator Nicole Mitchell in Becker County Court in Detroit Lakes. That was Deputy Leah Honer of the Becker County Sheriff's Department, but last year, April of last year, she was a correctional officer in the Becker County Jail. So what she testified to, it was pretty short. They showed basically the video from the jail, the booking area. There was no audio there. They just showed Nicole Mitchell coming in. And then they asked her about some of the items that she got from Nicole Mitchell. And one of them was a pair of gloves that are flashlight gloves. And then it showed also a receipt from Amazon showing that Nicole Mitchell is the one that purchased a pair of flashlight gloves, matching what they found. And they're basically a pair of black gloves. There's an LED light on the thumb and on one of the fingers. And, there's no evidence that saw that whether she was using that. She had the flashlight with a sock over it, but she had those with her. And, that would be part of the evidence that the prosecution's using to show possession of burglary tools.
Yeah, but part of the process of thinking it out, driving up there, how she was dressed that early morning.
Yep.
Hiding the car, parking the car off of the main street into the house. So all of these sort of thought processy things, the scheming, the plan.
You see him. Oh well, we saw him for a second, and there's Nicole Mitchell as well, right there with her defense attorneys at the defense table. And this officer, now deputy, will take the stand, and presumably we'll see his body cam video as well. We resume our coverage.
Ethan Wolthe, last name W-O-T-H-E.
Sir, where are you employed?
Currently employed with the Becker County Sheriff's Office.
And what's your current title?
Deputy Sheriff.
So you're in Brown here today?
I am in Brown.
Where were you employed on April 22nd of last year, 2024?
I was employed with the Detroit Lakes Police Department.
Deputy Wolthe, will you please outline your education and experience to become a peace officer?
I have a degree from the Alexander Technical Community College in law enforcement. I also do multiple continuing education trainings required by the Minnesota Post Board every year.
Was your job at the DLPD your first law enforcement job?
It was.
Okay. And when did you start there?
I started 2 years ago on the 4th of July.
Deputy Wolfie, I want to turn your attention back to April 22nd of last year, 2000. Or were you working that morning?
I was.
Do you recall what shift you would have been assigned to?
I do.
Can you tell us?
I was working 6 p.m. to 6 a.m.
Who were you working with at the time?
Officer Joel Sternhagen.
Would he have been, would superior be an incorrect word?
No, he had more experience. He had more seniority than I do.
Okay. At some point, were you dispatched to a residence in Detroit Lakes?
I was.
And where were you dispatched to?
I believe the address is 706 Granger Avenue, or Granger Street, Granger Road.
And would you agree that whatever the records show is be accurate?
I do.
Why were you dispatched to that residence in Detroit Lakes?
I was dispatched to that residence for a report of an active burglary. Dispatch advised that the caller supposedly stepped on someone and that party ran to the basement of the residence and might be trying to get out through the basement.
From the time that you pull up in your squad as you enter the house, can you walk us through your response?
I was running stationary radar at about Highway 10 and 59. When I arrived at the residence, I knocked on the door and was greeted by an older female. She had to unlock the door for me to go in. Once I got inside the residence, she motioned me to the south wall of the house where the stairs to the basement were and said, someone's down there. I can't remember what her exact words were.
And what did you do at that time?
I got to the top of the stairs. I announced my presence. Police department, show us your hands, make yourself known. And while I was doing that, I heard some rustling coming from what I believed was underneath of the stairs.
Did you announce your presence more than once?
I did.
And at some point, what happened on the stairs?
What do you mean?
Did your partner arrive on scene?
My partner did arrive on scene shortly after I announced my presence and advised whoever was downstairs or whatever was downstairs to make themselves known.
Who got to the foot of the stairs first?
I believe Officer Sternhagen did. He told me to step aside and he went down the stairs.
And what happened next?
From after we made it down the stairs, I went left. Officer Sternhagen went right. I couldn't see exactly where he went, but from what I could see, I went into a open room in the basement to make sure nobody was in there. And then while I was doing that, I heard Officer Sternhagen tell somebody to show us their hands or something like that.
Were you ultimately advised of the suspect's identity?
The suspect, it was, we asked to do this thing, look in house, see if they are in our system, and dispatch advised they didn't find them, but the suspect did give us a name and date of birth.
So what happened after the suspect was located?
When the suspect was located, Officer Sternhagen had the suspect get on their stomach, and I entered the room at that point and handcuffed the suspect with their hands behind her back.
Do you recall, you testified earlier about an elderly or older female. Do you recall the homeowner's name?
Carol was her first name.
Recall her full name?
You want me to say her full name?
If you recall it.
I believe it's Carol Mitchell.
Okay. When the suspect is arrested, where was Ms. Mitchell at this time?
When I placed handcuffs on the suspect, I looked up in the doorway and observed Carol standing in the doorway of where we came in.
Okay. At some point, did she make her way downstairs?
She did, yes.
Was that at your request?
It was not.
Okay,
before I went downstairs, I asked her to stay upstairs until we got the situation handled. But
Would it fair to say that wasn't ideal that she had come downstairs?
That was not ideal, no, for a safety standpoint.
At some point, were you able to help Ms. Carol Mitchell back upstairs?
I was.
Okay. Deputy Wolde, again, did you became aware of the suspect's identity? Is that fair to say?
Yes.
Can you tell us who it was?
It was Nicole Lynn Mitchell.
You see Miss Mitchell again? If you saw Miss Mitchell again, would you recognize her?
I would.
Do you see her here in the courtroom today?
I do.
Can you describe where she's seated and what she's wearing?
She's seated to my left at the end of that table wearing a purple shirt.
Does the record reflect the witness has again identified the defendant?
The record will so reflect.
Did you interact with the defendant inside the house?
No, I left that to Officer Sternhagen.
So what were you doing at this time after the defendant was arrested or detained?
After the defendant was arrested, I was trying to get Carol upstairs away from the situation so Officer Sternhagen could try and get a statement from the suspect. I did get her upstairs, I believe, but we later came back downstairs.
At some point, did you become aware of a foreign object or item belonging that you believe belonged to the defendant?
I believe it was Deputy Bruce mentioned there was a hammer sitting on the stairwell that I came down. When I asked Carol about the hammer, she stated that it was hers and she used it for protection.
Okay. What about in the back window, Deputy?
There was a blue crowbar found in the egress window on the south side of the house. We were made aware of that later on while I was at the police department typing my report because Carol found it and called us to notify us about it.
Okay. I apologize, Deputy Willie. Let's stay chronologically here. Close in time to the defendant's arrest, did you discover anything or learn of any other possessions the defendant may have brought into the home?
While I was downstairs in the basement, in like a utilities room, I would call it, I located a black backpack sticking in a small window, about taller than I was.
Did you photograph that backpack prior to moving it?
I did.
Took multiple photographs?
I did, yes.
Deputy Wolde, I'm showing you what's been marked as Exhibit 16. Can you let me know if that's on your screen?
It is.
Okay. And next, Exhibit 17, 18, and 19. Can you tell us what's in those photographs?
Well, there's a shelf in front of the window, but like I mentioned prior, there is a black backpack shoved in a small, I don't know what kind of window it is, but a small exit to the outside.
Are Exhibits 16 and 19 true and accurate depictions of the scene that day?
Yes, they are.
Your Honor, I would offer Exhibits 16 through 19 at this time.
No objection, Your Honor. Exhibits 16, 17, 18, and 19 are received.
And again, I just asked to briefly publish, Your Honor.
You may.
Deputy Williams, starting with Exhibit 16, just briefly tell us what this is.
It's pretty much the same picture as shown before, but a closer up of the backpack that is lodged in the window.
Okay. Exhibit 17?
Pretty much the same picture. I tend to double click my camera sometimes. So.
How about 18?
That's a farther back picture of the backpack located in the window, just with more of the quote-unquote clutter in front of the window.
And again, 19?
Same picture. Like I said, I tend to double-click my camera when I take pictures.
Can you describe how this backpack was wedged in the window?
It was wedged in the window. I tried to pull it into the house from the inside, but I was unable to. I had to have Deputy Bruce go from the outside to get it unlodged from the window.
You were unable to pull it into the house.
Correct, yes. I could not pull it into the house.
Okay, so what did you do next, Deputy Wolfe?
I brought the backpack upstairs. I believe I brought it out to my squad car and then interviewed Carol.
What did, when you said Carol, you mean Carol Mitchell?
Yes.
Okay, what did Carol Mitchell tell you at that time?
While I was with Carol, she stated that the female located inside her house was her stepdaughter, I believe. I might be mixing that up. And then she ran me through some family troubles that they might have been having in the past.
And you testified you took the backpack out to the squad?
I retrieved it from Deputy Bruce and then took it out to the squad car.
And just tell us who Deputy Bruce is.
Deputy Bruce, he's a canine handler for Becker County. We called him to the scene because there was maybe thought that the suspect might be trying to leave the residence.
So at some point you retrieved the backpack, fair to say?
Yes.
Okay. And did you later inventory that?
I did search the backpack later, yes.
What did you find in the backpack?
Inside the backpack, I located Nicole Mitchell's driver's license, Senate identification, 2 laptops, some Tupperware and a couple of water bottles, and then there was like some rubber gloves in there at the same time.
Approach the witness, Your Honor.
You may.
Deputy Wolfe, I'm showing you what's been marked as Exhibit 20. Do you recognize this?
I do.
Can you tell us what this is?
It's a black backpack, or not backpack, laptop.
Is this one of the laptops that was recovered from the backpack?
Yes.
Your Honor, I'd offer Exhibit 20.
I have no objection, Your Honor.
Exhibit 20 is received.
You told us about the contents of the backpack, correct?
I did, yes.
Do you recall reviewing a note that was inside the backpack or a list?
I do.
Was that list retained?
That list was not retained at the scene.
Okay. Deputy Woolley, how many burglary calls had you responded to in your career at this point?
This was my very first act of burglary I've ever responded to.
Would it be fair to say your adrenaline was going?
Yes.
At some point, did you, at some point the defendant was turned over to Officer Sternhagen?
The Nicole Mitchell was with Officer Sternhagen pretty much the entire time.
Did she tell you or Officer Sternhagen about her vehicle?
I located keys in the backpack, and Officer Sternhagen advised me where she stated her vehicle was.
Okay, and where was it?
It was about 1 block to the west, and then halfway up another block to the north.
Was it parked directly in front of the residence?
It was not, no.
Deputy Woolley, were you equipped with a body-worn camera early that morning?
I was, yes.
Was your response to the scene recorded?
Yes, it was.
Did you have a chance to review that recording prior to court today?
I have, yes.
If I told you that your recording was marked as Exhibit 1 in the court's system, would you have any reason to doubt me?
I would not know.
Your Honor, at this point, I would ask to publish Exhibit 21.
No objection, Your Honor.
I will advise the court it is a lengthier recording.
Exhibit 21 is received.
Sorry, I'm still.
You're good.
Carrie. There's a drop window on the back side of the house, and I don't know if that's.
Is he outside or inside?
He ran down.
Okay, I'll go down there. You stay back here.
Okay.
Police department, make yourself known. Police department, make yourself known. 37 Becker got a little motion underneath the stairs in the house. Sounds like he's trying to get outside of the back to the north of the house. Police department, make yourself known. He's still in the house. A lot of motion underneath the stairs. Sounds like he's trying to get outside through a window. Police department, make yourself known now. Where's he at? Here underneath the stairs. Police department. Underneath the stairs. That's why I was hearing motion at. Like commotion. Is there a way to get underneath the stairs? Oh no, you stay back, stay back, stay back. send Becker with 1012.
Carol? Yeah? It's Nicole. It's Nicole? I was just trying to get hold of my dad's things because he wouldn't talk to me anymore.
She also stole documents out of her house. She's my stepdaughter.
I didn't steal any documents. How did I steal documents?
Nicole, what's your last name?
Mitchell.
Had your aunt Nancy do it.
30 Becker with
No one
1058.
did anything.
Is it Nicole Mitchell in house?
Stand up. You
No
got anything
one
on you?
stole anything here, Carol. I don't have anything on me.
Not tonight.
Anything on you?
I'll meet you upstairs.
Why was she squatting down next to my bed?
Who is this to you?
Pardon?
Who is this to you?
She's my stepdaughter.
Stepdaughter.
She's also a Minnesota senator. She lives in the Twin Cities.
She's a senator?
Yeah. Yeah. Was.
Was or is currently?
She is. I meant after this.
Oh. Okay.
My husband passed away just
That's kind of why I recognize her maybe then.
her father. And right the day after he died, her aunt from Fargo came here. And I was in bed with mom, and they walked out with all these, it was two of my husband's sisters. She's very close to one of them, Nancy.
Okay.
They were walking out the door with all these forms, and I ran out there. I said, "What are you guys doing?" Nancy said, "We're just trying to help you, just trying to figure out where you are financially."
No, it's my partner. Supposedly,
So I stepped out.
1015 is a senator from Minnesota. So I don't know if that does anything, but.
Walked into my house, and she was laying next to my bed.
Where's he at? He's downstairs with her still. To the left. Okay.
Oh my God.
Has she done this before?
Not that, but she's insisted that my son should get nothing. She should get everything, all that stuff. She's trying to
Where'd she come in at?
get into my
Do you know? You don't know?
No.
Any doors that are open?
The doors
Does she have
open,
keys?
They had those
Those sticks?
sticks on them.
Okay.
Perhaps her windows are blocked, but I had this stick on it.
You had the stick on
it?
it?
Officer in. So I could cover it.
Okay.
I don't know anything.
Any windows open that you don't know of?
My little kitties haven't run off and stuff.
Okay, any windows in the basement? To the basement?
And that's the one I think that she asked me.
Where's that window at? Just tell me, I'll walk down there and take a look.
You can see it. She's trying to help. She's trying to get me. She helped. I can show you my bank account.
Let's go upstairs.
I'm thinking it would have had to have been this one, but I have no idea.
So this is the
Still on
only
there.
window? You have a stick in there? Is that what you said?
No, I have, the screen is still in there.
Okay.
I don't know. Yeah, this gets it messed on here.
You're all good.
I haven't done anything.
Any
down
windows
here.
over here?
Just put little tiny things. Yep, there it is.
That window?
Over there. Huh?
Okay. Is this her bag?
That's big.
Yeah, stuck in the window. Yeah. I'll take a picture of it before I touch it.
Something woke me up.
Did you hear something?
Something woke me up.
Okay.
I stepped over the side of the bed and there was a body laying on the floor next to me.
Okay.
What would you do?
Okay.
How crazy is she?
What do you know what she'd be here for?
She's... What's a story? See, paperwork, bank account numbers, I have no idea.
Okay. I guess we'll check that bag, see if anything in there is yours.
Yes.
Looks like you got it all. I'll just have you wait upstairs. I'll go talk to them. And...
Wait, we'll close up that window, won't we?
Yeah, I can close it for you. Yeah.
Look like one of those paintings.
Can I use this ladder here?
Yes.
Okay.
Move anything you need to move.
What are you at? See, Ben? Oh, there's a hammer on the steps. 3705. Where'd you say that hammer was? I copy. Okay. I got it close for you. I'll meet you upstairs. I'm gonna go talk to my partners and I'll come back and talk to you. Can I just grab your name, just in case dispatch didn't get it because stuff was kind of active? What's your first name?
Carol.
Carol, how do you spell that?
C-A-R.
Well, middle initial.
L.
L. Last name?
Mitchell.
My
T-C-H-E-L-S.
date of birth?
11/3/1949.
49. Okay.
Did you see it?
The hammer out there?
Oh, it's up.
Oh.
I had a hammer.
Oh, you got a hammer there?
That one's mine.
That's yours? Okay.
That was my protection here.
Alrighty. I'm gonna go talk to Joe quick. I'll meet you back in here. Just take some deep breaths. I know that. I know it's your bedroom. Was there anything missing from there?
I don't even know she was.
I know it's your personal space, so. She was laying right here.
I crawled out of bed and stood. So I don't think Brad had anything. I had some journals over on that side.
Okay.
I don't know. And my socks.
Okay. I'll go take a look at that bag.
Yes.
I'll get the adrenaline pumping.
You know, you enter right now. I didn't go through the backpack. There's a carpet there.
You want to look through this bag? Do you have Carol in the call? ID, but I don't know if it means anything, but she's a state senator. Yeah. So I'll run this since they're busy, so. Do you have it? I've got it. Anything else? She's got a Prius parked that way. There's keys there. Okay. So I tried looking for it. There's 2 laptops in there, so I'm gonna go ask her if one of them are hers, but I didn't find anything. Okay, where does that found at? This was found in the window she came in. Okay. Did you get a picture of the window and everything? Yep. The hammer's not really? The hammer's not hers. Okay. So, Mom said that was hers for protection because she woke up in bed and she was laying by her bed. She was? Yeah. Oh, well. She ran downstairs? She ran downstairs. And then when I got up the stairs, I heard a bunch of rustling, so. I didn't find anything of interest in there. Okay. I'll ask her about the laptop. Okay. I'll run this.
For 16. Let me check monitor tail has someone that couldn't start a word just in case. 10-4 and try 301 when you have time. No. Hold 5, it'll be that second building there, top floor.
Parked around the corner, so just want to get that added. What's going on? Yeah. Okay. Better add it. Yep.
6100 units. Sounds like the suspect left. Known to wear an orange jacket, but she's not sure if he has it on now. He's short, an American male, long hair.
I'll go ask about that laptop and. So the only thing I found in that bag was 2 laptops. Do you have a laptop in here?
Well, I have 2 laptops that are unplugged, mine and my husband's.
You have 2 laptops?
I had to.
Where are they at?
I don't know.
Do you want to go look for them? Do you know where they were at?
No, I don't even know. I'm also not.
Do you know what they look like?
They're just those little laptops.
Would you know if I showed you?
Maybe.
Okay. I'll go get them. What else?
I call it the tin box. It's a metal steel gray box that's always had all the legal documents in it.
Okay.
That's what they broke into before. Had her aunt do it. Stole a bunch of stuff out of there. And so I was just looking for that.
Okay.
I can't find that anywhere. But
You just want to put the knife away for me? She Miranda's? Yeah. Alright.
Hi.
What's your name?
I'm calling you.
Are those laptops in your backpack yours?
Yes.
Okay. She's saying she's missing 2 laptops.
I can show you one. It's got like his Minecraft game on it.
What's the other one for?
I have one for work.
Okay. And then she's saying something about a tin box. That was a question. It was in question last time. So.
I literally had just got in the house. I hadn't had time to do anything.
Okay. All right.
I'm clearly not good at this, but
yeah. So, sounds good.
again, I know this sounds like an excuse. She has Alzheimer's. She's been misplacing things. I can show you texts going back months saying, things are missing, this and that.
I'm just asking, so it's not a reason to break anybody's house.
No, that wasn't my intention.
Alrighty. Alright, I'm back.
Searching for that metal box, trying to see if I can find it.
Okay. I searched her bag and didn't find a metal box.
She must have a vehicle around here. So.
Yep. I'll go look in the box or in her car.
Okay.
But the laptop's the story she gave me is pretty good for work and her kids. But it's going into our evidence, so if something does change, we'll get it back to you.
Okay.
Look for those. I get back on them with the laptops.
Oh, I thought you meant you did find her laptops.
From what she told me, that sounds legit, especially for what she does for work. And everybody's got a laptop, so if you don't find those, we can always go back. Like I said, they're going into our evidence, so look for the tin box. Like I said, I didn't find anything in the backpack. I'll go look in the car.
Okay, so the silver gray.
Silver gray?
Yeah.
Okay. Do you have any further questions for me? It's been a busy morning for you, so.
She's alone, right? I mean,
yes.
Nobody else hiding in my house here?
No. I can look for you if you want.
Okay. I just shut that bedroom door because my one kid in there, I have two kitties.
Okay.
They're both feral rescues. Chloe was right there. It doesn't bother her. Leo was hiding, so I let him go in there.
Okay. Any other places you want me to look before I leave here?
For missing stuff.
For anybody in your house?
Oh, I think you guys pretty much looked everywhere, didn't you? I think that should be okay.
She said she just got in here, so I don't know if, from what she's saying, she wouldn't have time to stuff in that bag. So, and what she was wearing, she can't hide anything. So.
And she said to you why she got in here?
My partner took a statement from her. I just asked her about the laptops in the box. So.
Some papers or something.
Okay. So last time, this was a problem. She was after papers. Like, can I just ask the significance of those papers?
That's when the two aunts came here. They took all kinds of legal forms. I had my husband just died. I had the tin box sitting right now here because I was going through it, trying to find out what I was supposed to do, and I was totally out.
No, that's understandable.
So the box was wide open, and when I came out, there were papers and stuff scattered all over the floor, and the two gals were both walking out with somebody with papers down the front sidewalk to their vehicle. And I said, "Where are you going? What do you got?" And they said, "It's okay, Carol, don't worry. We're just trying to help you get this legal business all straightened out for we know you're upset."
Do you know why she would want those papers? Like, what would benefit her from having those papers?
See, my husband didn't have an actual will.
Oh, okay.
But on all the papers that were taken, there were at least a half a dozen of them more. I've gone through there a number of times, looked at my tax things and whatever, that he had handwritten. When I broke, Carol gets 100%. When Carol breaks, Nicole gets 50% and Jonathan gets 50%. Jonathan is my son, whom I had given up for adoption when I was 18, and we were reunited 35 years ago. So anyway,
So you think it's for like inheritance stuff?
Yes.
Okay.
It was bank papers. It was all bank papers that broke up, basically. And I think locally at Wells Fargo, and Rod managed Wells Fargo out of the Fargo office while he was still working. So there was a lot of bank papers. And I just, I'm a little reflective. I used to keep that little box, but I took it out of there, and it's not there anymore. So I'm thinking that's what she was looking for. Okay. Well, she was hiding on my bed for it.
Yeah.
Did you see where she was? Did I show you where she was?
Yep, you did. I might have to.
Nothing back there, but
Yeah, I might have to get going because there's another active burglary in Frazee. So.
Thank you. Thank you.
And for 16, I'll be on en route shortly. Sorry about that, sir. Go. Sure. What apartment am I going to?
Apartment 23.
So Deputy Wolfe, you collected that laptop at that time?
Not at that time, no.
You collected it later in the morning?
I did, yes.
It was brought to the jail, is that fair to say?
Yep, I believe from the video it shows that the backpack was in Officer Sternhagen's vehicle.
At some point, you logged that laptop into evidence, is that fair to say?
Yes.
At the DLPD?
Yep.
And would it be accurate to say you didn't know, when you left that morning, would it be accurate to say you didn't know who that belonged to?
That would be correct, yes.
Deputy Woolley, were you called back to Ms. Mitchell's residence later that morning?
I was, yes.
Can you tell us about that?
Carol called back in, stating that she had located a blue crowbar in an egress window on the south side of the house.
Was anyone with her at that time?
Yes, I believe there's a male with her, but I don't remember his name.
Was that response also recorded on your body-worn camera?
It was, yes.
Did you have a chance to review it prior to court today?
I did, yes.
And was that body-worn camera clip shortened for relevancy and efficiency reasons?
It was, yes.
If I told you that camera footage was contained in Exhibit 3, would you have any reason to doubt me?
I would not, no.
And again, you reviewed it prior to court?
I did, yes.
Your Honor, I'd offer Exhibit 23.
I have no objection, Your Honor. All right. Exhibit 23 is received.
I would ask to publish, and this is much shorter, Your Honor.
Okay. You may publish.
Your Honor, just ask for a brief sidebar with counsel.
footprint something?
Yes, it's,
Where's it at? Outside?
sure, yep, it's in that little back egress, and I don't know,
Okay.
you got some kind of long tool there?
Gotta reach for
My
it.
friend Jim showed up to help.
Help you calm down, maybe?
Yeah.
Understandable.
And it's okay.
Okay. You never seen that before?
No, it's not mine.
Alrighty, I'll jump
Never
down
had a
there.
blue one.
Okay.
Maybe traded broken. I have that on there. Oh, be careful. There's probably a week. If you want to move some of those bricks to get back out of there.
I'm just looking for damage down here now.
It was a week ago, a couple weeks ago.
Yep.
That window, the inside window was open about this far. It used to be my studio, and since my husband's died, I've been shoving stuff in there from all over the house, so it's a disaster down there. But it felt cold in the basement. Heat was kicking on a lot. I happened to check this one, and it was open on the inside about that far, and it's one of those roll ones. So now to find that, she might have her fingerprints on that. So.
Yeah.
I closed it, and I jumped down in there myself, and
May I approach the witness, Your Honor?
You may.
Deputy Wolby, I'm showing you exhibit, what's been marked as Exhibit 15. Do you recognize this?
I do.
Can you tell us what this is?
It's the blue crowbar from the video.
All right, offer Exhibit 15.
No objection, Your Honor. Exhibit 15 is received.
Deputy Wolby, when you retrieved that crowbar, do you have any regrets over best practices?
I do. Looking back, I should have photographed the crowbar in the egress window, and then try and find any footprints in the dirt of the egress window before I jumped down there, and then also picking up the crowbar with my bare hands. I just want to note that I was going on a couple hours past the end of my shift. The adrenaline finally shut down, so I was getting down there on energy, so sometimes I didn't think very straight as I was tired.
And just to be clear, Miss Carol Mitchell had told you that she had never seen that before.
He did, yes.
Did that conclude your shift that morning?
I'm not, I believe it did, yes.
Well, let me ask you this, Deputy Willie. Did you return to the residence yet again later that morning?
Yes, I did. I returned with Officer Joe Steffens this time.
Okay. And what was the purpose of that next return trip?
When we returned, we went to go talk with Carol some more, and Officer Steffens also photographed the vehicle we talked about the night prior.
And you were on scene with him when he took these photographs?
Yes.
Okay. And you've had a chance to review the photographs prior to court today?
I have, yes.
And these are photographs of the defendant's vehicle?
Yes.
And what else?
The inside of it.
Were there some photographs taken of just the residence itself?
Oh, yes, there was. We also took photographs from the outside and better lighting of the window that the backpack was stuck in.
And all the photographs that were taken that morning, do you believe they were true and accurate of the scene in the vehicle that morning?
I do.
Your Honor, at this point, I'm going to offer exhibits 26 through 48 and understand if counsel needs time to review each one.
Your Honor, I reviewed them. I have no objection to any. Exhibits 26 through 48 are received.
I might just need one moment here. I'd ask to publish in chronological order, Your Honor, 26 through 48.
You may.
All right. Deputy Wolde, I'm starting with Exhibit 26. Can you tell us what we see here?
This is a picture looking to the east from Long Avenue. Long Avenue would be the next avenue to the west of Carol's house.
Are we able to see Miss Carol Mitchell's house in this photograph?
Yes.
Can you describe where it is?
It looks yellowish with like the white gate thing on the front porch.
Would it be accurate to say that it's close to the center of the photograph, maybe a little north?
Yes, I would agree.
Next, I'm showing you, strike that. Returning back to Exhibit 26, what was the significance of this photograph?
It just goes to show the distance from Carol's house to Long Avenue, the next block over.
Okay, what is the significance of Long Avenue to this case?
Long Avenue is the next avenue from Carol's house.
Deputy Wolde, are you aware where the defendant's vehicle was parked?
I am, yes.
Okay, where was it parked?
It was parked just north of Granger Road on Long Avenue.
Next, turning to Exhibit 27. Can you tell us about this photograph, sir?
It's pretty much the same photo, but of more of the intersection of Long Avenue and Granger Road, where you can see Carol's house and Nicole Mitchell's vehicle.
Can you describe where the defendant's vehicle is in this photograph?
It's on the right side of the photograph and looks like a blue Toyota Prius.
Next, I'm showing you Exhibit 28. Can you tell us what's in this photograph, sir?
This is a photograph facing directly south on Long Avenue, pretty much right at the intersection with Granger Road.
Next, turning to Exhibit 29.
It's just a closer picture of the vehicle on Long Avenue.
And Exhibit 30.
Be the passenger side of the vehicle.
Exhibit 31.
Still the passenger side, but from the front. Directly, or the direct front of the vehicle.
Sorry, this is Exhibit 32.
No, it'd be the direct front of the vehicle.
And Exhibit 33.
It's the driver's side from the front.
I'm going to need a moment here. I apologize. Could I return to the publishing, Your Honor?
You may.
All right, Deputy Wolde, next I'm showing you Exhibit 34.
This is a view from the driver's side window inside to the inside of the car.
And next, Exhibit 35.
To be on the same side, but looking in the window from the back window of the car.
Exhibit 36.
It's taken top down from the hatchback trunk area.
And Exhibit 37.
It's the back seat of the car from the rear passenger side window.
And Exhibit 38.
It's a picture of the inside of the passenger side compartment of the car from the passenger side window.
All right. Okay, Deputy Wolthy, resuming with Exhibit 39, what's the publication?
It's a picture including the same vehicle from before, looking towards the area of Carol's backyard.
The area, is that an alley on the right?
Yeah, that would be an alley. I don't believe that's not a named street.
Next, turning to Exhibit 40.
It's the same picture, but farther south on Long Avenue with the vehicle looking in the area of Carol's backyard.
Exhibit 41, sir.
Would be the direct front of Carol's house.
Exhibit 42, Deputy Wolthy.
That is a back door of the house, including the window that we found the backpack in.
Exhibit 43.
This is a close-up of the window the backpack was located in from the outside.
And Exhibit 44.
Just a close-up of the dirt of the window that the backpack was located in.
Exhibit 45.
It's a less close-up picture of the window that the backpack was found in.
Exhibit 46.
Same window, just lower and more in front of it.
Exhibit 47.
This is the egress window that the crowbar was found in.
And Exhibit 48.
The same window that the egress window that the crowbar was found in, just closer up and farther inside of the egress.
When you returned again for that third time that morning, you said you spoke with Carol Mitchell again?
I did, yeah.
What did she tell you at that time?
She told me more about some of the family problems that they had been having. She was, I believe, also again concerned about the tin box that she had mentioned when I was there in the early morning.
Deputy Wally, do you recall that she demonstrate again where the defendant was in her home?
I don't recall, no.
Okay. At some point, did you return, or strike that, at some point, did you interview the defendant at the Becker County Jail?
I did, yes.
And was that captured on your body-worn camera?
It was, yes.
Did you have a chance to review it prior to court today?
I did, yes.
Is it a true and accurate copy?
It is.
I told you it was marked as exhibit Exhibit 22, would you have any reason to doubt me?
No.
Your Honor, I'd offer Exhibit 22 at this point.
No objection, Your Honor. Exhibit 22 is received.
I would ask to publish.
You may.
discrepancy with the laptops. Are you able to sign into those laptops?
I'm sorry, what?
Will you be able to sign into those laptops?
Yes.
Okay. I know you already read these. I'm going to read them to you again. You have the right to remain silent. Anything you say can be used against you in court of law. You have the right to an attorney. If you cannot afford one, one will be provided for you. If you decide to answer questions now without attorney present, you still have the right to stop answering questions at any point until you talk to an attorney. Do you understand these rights?
I do.
Okay. So are you willing to sign into those laptops to prove that they're yours?
Yes.
Okay. I have them out here. So you can come out and sign into them. There's the first one. Okay, how come it has Carol's name on it?
It was one that she had given me way back when to use for the kids.
Well, she's missing 2 laptops. That's what she said. So I'm taking this laptop. How about this one? Okay, that one's got your name on it. That one will stay with your property, but I'm taking this one.
That's fine.
Okay. Do you have any questions for me?
I don't have any questions.
Okay.
If she said she was already missing 2,
So
there's no way.
I brought it up.
I took them tonight.
Okay, they were in your backpack, shoved in a window.
The whole backpack was shoved.
Do you understand where I'm coming from?
I do. The whole backpack was shoved in a window.
So, you're Mirandized. Did you try shoving that backpack out and it didn't go out?
I want to answer your questions.
You don't have to. Like you understood your rights. So.
I guess maybe I should.
Okay. It's okay. Put you back in here. Appreciate you working with that. So.
Okay, they're tough. Stop recording.
So Deputy Wolve, you retained that laptop and evidence at that time?
I did, yes.
The ownership of it was in dispute, I guess, for lack of a better word?
Yes.
And anything related to that investigations would have flushed out one of your superiors?
What do you mean by that?
Well, that concluded your investigation in terms of the laptop. Is that accurate?
Yes.
You're part of it?
Yes.
Okay. Deputy Wolve, did that essentially conclude your involvement in this case?
Yes.
Is there anything else that I haven't asked you that you think the jury should know?
I do not believe so, no.
Thank you, sir. I have no further questions.
Mr. Ringstrom.
Thank you, Your Honor. Good afternoon, Deputy Wolfe.
Afternoon.
Deputy Wolfe, you had testified that, expressing that you wish you had dealt with the crowbar a little bit differently. You said you were pretty tired and kind of had a bit of an adrenaline dump. Is that a fair statement?
Yeah, the adrenaline was just, I was coming down from the adrenaline.
Okay. Is it sort of like hard to think and so on at that time?
Yep.
Okay. How old were you when this incident happened?
21, I believe so. I believe, 21. Years get mixed up sometimes.
Fair enough. Did you have a chance to review all your body cam before you testified here today?
The ones that were showed, yes.
Okay, that's what I mean. What the jury has seen, you watched those before you came in here to court today?
Yes.
Okay. How were Carol Mitchell's doors locked or secured in this house?
When I entered through the front door, I believe she had to open both the screen door and the main door, and she had poles, locking poles on, or up against the doorknobs on both the back and front doors.
So sort of like a bar or a pole that would, the expression I heard on the video, and you tell me if I'm correct, was those sticks. Do you recall her saying that?
Yeah.
Okay. And this was some kind of a bar that would stick under the doorknob and then jam against the floor. Is that correct?
That's how I believe they worked. I don't know how they work for sure, but that's what I thought. That's how they worked.
And when you saw the video, did you see it kind of has like, it's like a little triangle against the table, or it creates that slight angle against the door? Is that your understanding?
I didn't see that. From what I saw and what I remember, it just looked like a angle stick that went up against the doorknob or door handle.
Understood. So your perception, and based on what Carol Mitchell told you, is that the doors weren't secured with a deadbolt, they were secured with those angled sticks.
When I entered the house, I thought I observed her unlocking locks on the door as well as removing the stick.
Okay, thank you. How much time did you spend downstairs?
I'm unsure. Like I said, if you rewatch the body camera, you could start when I went downstairs and then upstairs, but I don't know how much time I spent downstairs.
When you were downstairs, and I'm talking about when the call first came in and you went downstairs, did you see any piles or collections of belongings at either of those two windows?
No.
Okay. At any point, and did you ever turn your body camera off when you were down there?
No.
Okay. Did you hear Carol Mitchell say there's some odd stuff that she must have put by the window or anything like that?
I don't recall that moment. I remember when we were upstairs after Nicole was with Officer Sternhagen, she mentioned that she had a box of stuff upstairs after he died.
That was the tin box discussion?
The tin box discussion, I believe.
And maybe I'll just ask as directly as I can. Did you perceive when you were there the first time a stack or a pile of stuff that appeared that it was being staged to be taken out of the house by someone?
No.
Okay. When you when you inventoried the backpack, did you find any garments in there?
You say garments?
Garments, like clothing.
No.
Okay. Did you find anything during that inventory that, besides the laptop, which is being discussed in here, besides that, was there anything else in that backpack that needed to be brought back into Carol Mitchell's house?
At the time of searching the bag, no.
Anything after searching the bag?
Yes, the laptop that was opened and Carol Mitchell's name popped up on it.
Right. We already talked about that. I'm saying, is there anything else in that backpack that anybody laid claim to or claimed that was Carol Mitchell's or Rod Mitchell's?
No.
Okay. The photographs that we saw of Nicole Mitchell's car, you were able to see in kind of the hatchback of this vehicle?
From the picture, yeah.
And you did examine that. We obviously introduced them through you. You did examine those pictures?
The pictures, yes.
Yes. Did you see anything in those pictures that appeared to be any kind of tin box?
No, I didn't.
Okay. Did you see anything in those pictures that appeared to be a flannel shirt or a flannel jacket or anything like that?
No.
Did you see anything in those pictures that appeared to be like an urn, like a funeral urn, or like a big fishing bobber or something like that?
Nope.
Okay. Did you ever get a call or a request from one of your superiors about any of the items that wasn't inventoried or that might have been missed here?
You mean like?
And again, I'm not trying to ask a tricky question. Was there ever a time when one of your superiors said, there was this thing that we think Nicole Mitchell had, and we think it might have been Rod's? Do you know what happened to that? Did you see that or anything?
No, I never got a phone call like that.
Okay. Deputy Wolfe, I want to direct you to your first body cam. If Your Honor, Mr. Keller is going to control this, if we can get permission. And I believe this is Exhibit 21. Yes. Okay. So we are looking at Exhibit 21, and since it's already in evidence.
Go ahead. I just interrupted. I was just asking if you wish to publish it this time.
I do, Your Honor. I apologize for not asking in advance. So we're going to have you watch, I don't know, maybe 30 seconds or so, and then we'll circle around and I'm going to ask you some questions, okay? Go ahead.
I'm going to go talk to my partners and I'll come back and talk to you. Can I just grab your name, just in case dispatch didn't get it, because stuff was kind of active?
So Deputy Wolde, I just showed that to you to refresh your recollection and provide some context as to what we're going to talk about here. So Deputy Wolfe, the lower left corner, my fault, on the lower left corner of the screenshot there, what do you see there? Appliance.
I'm not sure. Right now it kind of looks like a colored knife.
Okay, I'm actually talking about the entire, let's see here. The way I described it was inaccurate. I was looking at the image reversed, so I apologize. If you can give me a moment. If we can unpublish it for a moment, Your Honor, we'll bring it in. It's my fault for seeing it transposed. While we're doing that, I'm going to go ahead and just ask a couple of questions, Deputy Wolfe. I want to ask you about the black backpack. Did you touch that when it was still in the residence?
I think so. When I watched the camera, I told myself I'll take some pictures of it before I touched it, but my hand was on it.
And I'm not criticizing that.
Yeah.
I'm just curious. So, did you tried to pull it back into the residence?
Yes.
Okay. And did you pull reasonably firmly? I mean, you tugged hard enough to hopefully get it pulled through?
I would say so, yeah.
Okay. And in doing that, that did not actually, it didn't get pulled through, correct?
It didn't move inside at all.
And so it was Deputy Bruce, the K-9 deputy, who actually pulled it from the outside?
Yep, he went out, he left the basement and went outside to pull it out.
Okay, fair enough. When you went through, and what I'm going to do, Deputy Wilthy, is we can look at the video later. When you went through the backpack, did you testify that you found gloves in there?
Yeah, I remember on the scene there were crumpled up plastic looking like clear rubber gloves.
Okay.
That's what I thought they were.
Were they? So law enforcement officers and medical professionals use a certain kind of rubber glove. Were they like that? Were they thicker? Were they different?
It'd be like when you're serving a public event with those white or those clear ones, you can see straight through them. Ours are usually black or gray.
Okay, okay. Deputy Wilthy, you did not get a search warrant for the vehicle, correct?
Mm-hmm.
Hang on a second, Mr. Ringstrom. Is that a yes or no?
No, we didn't.
And you also didn't execute it. You didn't get the search warrant, but you also didn't execute a search warrant on the resident, or on the vehicle, correct?
No.
Okay. Did you find Nicole Mitchell's keys?
I did in her backpack.
Okay.
Yes. Well, there was keys and they looked like Toyota Prius keys.
Okay. Were there any other keys there?
I don't believe so, no.
So the keys that you found was one single key or two?
Oh, you mean on the ring?
Yeah.
There was more than one on the ring.
Okay. Did you attempt to use any of those keys on Nicole Mitchell's doors?
I myself did not know.
Okay.
I attempted to press the lock button to get the horn to sound, but that's to the extent that I went.
And you didn't see any other law enforcement officer go up to Carol Mitchell's residence to try and use it on her house either, correct?
No.
Okay. Thank you, Deputy Wolfie. I have no further questions.
Mr. McDonald?
Deputy Wolfie, you found nothing that would suggest that the defendant took a tin or metal box that night, fair to say?
Yes.
Your Honor, could I republish briefly?
You may. What exhibit?
Exhibit 21. Deputy Wolfie, I've fast forwarded to 8 minutes and 24 seconds in your body camera footage. Do you see that couch in the background there?
I do, yes.
Okay. Do you see any window that's near that couch?
I don't see a window near the couch, no.
Now, you testified earlier that you went through the defendant's backpack, correct?
Yep.
And do you recall coming across a checklist or a note?
Yes, it was in my hand.
Okay. It was in your hand, like you pulled it out of the backpack?
Yep, and I had it in my hand.
I'm fast forwarding to 1434. Hereabouts. This is the note that you reviewed?
Yes.
Okay, and can you tell us, are you able to read what that note says?
It looks like the first line says call, do not disturb. It's shortened, abbreviated. It says delete text, and then quotations, contacts. And then there's a word I can't understand, but then it says ringer off, and then it looks like flashlight underneath of that. And then it says add tracking Gmail, and then text to something I can't read.
Okay. And would it fair to say that you didn't appreciate or didn't understand the significance of this at the time?
That would be fair to say, yes.
And it wasn't retained in evidence?
It was not, no.
No further questions?
Mr. Ringstrom.
Well, it's no longer published, but as you read that note, did that note have the word shirt on it?
I don't believe so, no, not from what I read.
Okay. You did just read it 60
Yeah.
seconds ago?
Yeah.
Did that note say ashes on it?
I don't believe so, no.
Okay. Did the note say papers on it?
I don't believe so, no.
Did the note say laptop on it?
I do not believe so, no.
Besides the things that you testified to, did it say anything else?
No, I read all the words that I could understand from the still shot.
Were there any words, even the ones you couldn't understand, that looked like the word mementos?
No.
Was there any words on there that looked like dad's things?
Not that I believe, no.
Were there any words on there that looked like bobbers?
Not that I believe, no.
Were there any words on there that looked like camping gear?
Not that I believe, no.
Were there any words on there about anything related to Roderick Mitchell?
Not that I believe, no.
No further questions, Deputy Wolfe.
Mr. McDonald.
The word flashlight was on that list?
It was, yes.
Nothing further.
Nothing further, Your Honor.
Deputy, you may step down. Watch your step. Council approach once deputy gets through the well.
All right, that is Deputy Ethan Wolfe, who was formerly a police officer with the Detroit Lakes Police Department, now with the Sheriff's Office. But last April, he was with the PD and was one of those responding officers to the home of Carol Mitchell.
How long have you been so licensed?
Approximately 15 years.
When did you first join the Becker County Sheriff's Office?
August 2015.
Where did you work prior to joining Becker County?
In the city of Detroit Lakes.
Was that your first law enforcement job?
No, my very first was in Wyoming, Minnesota.
Wyoming, Minnesota?
Yep.
Is that north of the metro, if I recall?
Yes.
Can you briefly outline your educational background?
I have a 4-year degree in criminal justice. I went to a tech school for the Academy for the police side of things, and yeah.
When did you become a canine handler?
Approximately, it was 2022 is when I went to training.
Okay.
Spring.
Deputy Bruce, I want to turn your attention back to April 22nd, 2024. Were you working that early morning?
I was.
Do you recall what shift you would have been working?
I worked the overnights, so either 7 to 6 or 6 to 6.
At some point, were you asked or were you dispatched to a call in the city of Detroit Lakes?
This Detroit Lake City police officers were dispatched to a call that I assigned myself to, yes.
Okay, and why did you join that call?
For a type of call that was given out, which was a burglary, typically my canine partner can be assistance. People run, hide, locating suspects if needed.
Okay. Can you tell us how it generally works, which agencies respond to which cities and parts of the county and such?
Yes, absolutely. So the city of Detroit Lakes obviously handles calls within city limits of Detroit Lakes. There's other smaller agencies as well throughout our county. Being a county officer, Becker County, we work closely with our counterpart agencies within our county, and we assist when able, besides taking our calls out in the county as well. So.
Okay. Deputy Bruce, will you walk us through as you responded to that residence here in Detroit Lakes? And let me back up a second. Do you recall what the address was?
I believe it was 709 Granger Road.
Okay. Can you walk us through your response that morning?
Yeah, so City of Detroit Lakes officers were dispatched to that residence for an active burglary in progress. Information provided to us at that time was that there was an individual inside the residence that had fled to the basement. There was also stated that there was no exit from the basement besides possibly out through a window. As I was still responding, Officers Sternhagen and Officer Wolthe, they arrived prior to me. They notified over radio that they could hear movement in the basement. And just as I was arriving, I believe Officer Sternhagen stated that he had made contact with the individual and ended up detaining that said individual as well.
Okay. What did you do at that time?
So when I arrived, I got out of my car. Being that they were in the house, I went to the backyard just for a quick secondary sweep to verify that there was no one else that may be lingering in the back area. I looked very quickly just at windows that appeared big enough that someone could fit out of to see if there was any broken glass or if they were ajar. Same with the back door that was on that side of the house. I then entered the residence, saw Officer Wolthe talking to who I believe is the homeowner upstairs. So then I proceeded downstairs to find Officer Sternhagen.
Deputy Bruce, this sweep of the backyard, would you consider this a meticulous sweep for evidence?
It was very brief. Nope, I was strictly looking for people and for any entrance to that house.
Okay. And was it still dark out at that time?
It was dark, yes.
Did you locate any evidentiary items?
The only evidentiary items that I located would be later on after I was directed by Officer Wolthe to grab a backpack out of a window that he discovered.
Okay. Can you describe, tell us about that, how you pulled it out and such?
Yeah, so Officer Wolthe, he found it while inside the residence in the basement. The window was super high. I wouldn't say high, but towards the ceiling. The bag was jammed in that window. Officer Wolthe tried to pull it back through. He couldn't, so I exited the house, went outside, and I was able to pull it outside that window, which was, it was a smaller window, and there was no egress per se, or what do you call the things that, the opening between the ground and the window. There wasn't much space there. It was ground level, so.
Did you interact with the defendant at all?
Correctly, no. I just stood and observed.
Were you equipped with a body-worn camera that morning?
I was.
Okay. Was it operating?
Yes.
Okay. Did you have a chance to review your body-worn camera footage prior to today?
I did, yes.
Okay. Was it true? Was it a true and accurate copy of your response that morning?
Yes.
I told you that your body camera was contained or marked as Exhibit 25 in the court's system. Would you have any reason to doubt me?
I would not.
Or at this time, I would ask, or I would offer Exhibit 25.
No objection, Your Honor. 25 is received.
I would ask to publish Exhibit 25, Your Honor.
You may.
Transitioning a radio to Cedar 1015. Burglary and clear 1033. And for clear 1033 at 452. And I see a Nicole Mitzel in-house. Mitchell. 10-4, not finding one then. Middle name Lynn.
Senator from Minnesota.
Don't get to my house. She was laying next to my bed.
Where's he at? He's downstairs.
Why are your shoes stuck nowhere? Well, because I was trying to get him with my feet. And you asked when I started to play him, and then I got you back. I have never done anything like this. You're going to find it out. I'm a military commander, for God's sakes. She's got severe Alzheimer, and there were just a couple things in my dad's that I wanted to come get. Because whenever you try to help her, she's not trying to help her. She's trying to get money. She kept, I can show you my bank account.
Let's go upstairs.
Stats of resources. I don't know. Yeah, this gets messed on here.
You're all good.
We haven't done anything.
Any windows over here?
Just put them in.
That window? This is her bag?
That's pretty. I don't know.
Yeah, stuck in the window.
Pepper 38.
And then you probably see what she was taking out of the house.
Can you confirm that name one more time?
You mean to go out and try to get it out? Yeah. 37, you can close that window. I also noticed a hammer on the steps. You might want to ask what's that on your way up. Steps, last step before the door. Yeah, I'll call you back in a minute.
Mitchell. M-I-T-C-H-E-L-S.
Date of birth?
11/30/1949.
Did you see it? The hammer out there? On the steps? Oh.
I have a hammer.
Oh, you got a hammer there?
That one I want.
That's yours?
Yes,
Okay.
for retention, yeah.
All right. I'm gonna go talk to Joe quick. I'll meet you back in here. Just take some deep breaths and all that. I know it's your bedroom. Was there anything missing from there? He's interviewing her right now. I didn't go through the backpack because there's no front of the car for you guys.
So, Deputy Bruce, at the end there, where did you go next?
We had our call in Frazee for another burglary in progress.
You testified you're a canine officer or handler?
Sorry.
Yes.
Yes. What is your canine's name?
Derman.
Did you have to utilize or let out Derman at all at any point in this call?
We did not.
Why is that?
It was pretty much all handled before I got there, so.
You were, the defendant was arrested as you got on scene?
She was detained by Officer Sternhagen by the time I got there, yes.
Your role became more of supportive at that time?
It was supportive, yep.
Okay. And as you, just to be clear, as you walked through that backyard and looked in the windows and such, you didn't spot anything at that time?
I did not.
But again, were you looking, the depth of searching was not what you would normally do in a follow-up investigation, so to speak?
I would agree with that. I was looking directly at the building itself.
Thank you, Deputy Bruce. I have no further questions.
Mr. Ringstrom.
Thank you, Your Honor. Good afternoon, Deputy Bruce.
Good afternoon.
You testified that burglary calls often need your services. A canine has possibly a special use in the kind of burglary calls that you find yourself responding to?
Absolutely, they have a purpose, yep.
They can find suspects who are trying to avoid capture?
Correct.
Canines can actually improve compliance with suspects as well.
They certainly can.
And as you testified on direct, Durham was not needed in any capacity here.
He was not, no.
Okay. Have you watched your body camera video before testifying here today?
Yes.
Okay. You recall when you were going back up the stairs to go outside to retrieve the backpack, seeing the lock bar on the door?
No.
Okay. If the video shows that there is a bar, a support bar, holding that door closed, as long as that's on your body cam, you would have no reason to dispute that, correct?
If it was on my body cam, I would not dispute that, correct.
And if it's on your body cam that there's also a stool that's laid up against that door, you would have no reason to dispute that, correct?
Correct.
Okay. You spent some period of time downstairs when Nicole Mitchell was detained. Did you have an opportunity to observe the environment at all, or look around or pay attention to anything?
Opportunity, yes. Did I? No, I was watching the female, Miss Mitchell, with Officer Sternhagen.
Okay. You did not see then when you were down there any piles of like belongings or things that were stacked by one of the windows down there?
I did not know.
Okay. Thank you, Deputy Bruce. I have no further questions.
Mr. McDonald.
No redirect, Your Honor.
All right. Deputy, you may step down. Again, watch your step.
All right, guys. So we went through day 2 of Nicole's trial. Now, next week, we're going to go full throttle. I promise. We're going to go full throttle through Nicole's trial. We're going to be back with the Ali trial as well. But y'all know they got that hell of a long lunch break. And so we're gonna get through both of them. I promise. But I do want to thank y'all for hanging out with me today. I got to go, be a woman of this house because, baby, I don't know what a woman been at all week. I barely cook for these folks. But I'm going to go ahead and get up off of here and start my weekend off right. I hope y'all do the same. Be safe. And I shall see y'all Monday. Oh, if you want to keep the conversation going, make sure you write over in the Discord chat. If you haven't joined our Discord, make sure you join our Discord, okay? Cool spot for us to talk about any trials, anything, any interesting headlines that we're following, and all that good stuff. All right, y'all. See you later.